From Kern Government Television, welcome to this week's Kern County Board of Supervisors meeting, originating from the County Administrative Center located at 1115 Truxtun Avenue, Bakersfield, California. Kern County's vision is to create and maintain a customer-centered county government designed to garner the confidence, support, and trust of the people we serve. Today's Kern County
to remain open in spite of the orders and recommendations from the governor. We have had 4 health inspectors spend a few days actually going business to business, asking individual businesses to heed the warning. It's important to note that the far majority have understood the order and have complied. There's just been a few that needed some additional help. There have been a lot of questions on personal protective equipment and the county's role in that. Since March 13th, we have filled more than 100 resource requests. These are entities asking for PPE because they have been unable to otherwise obtain it. We have 27 additional that are still pending that we have not filled. So to give you just a ballpark here, we have issued more than 100,000 N95 masks, more than 87,000 isolation masks, more than 13,000 gowns, almost 2,000 goggles, almost 10,000 bottles of hand sanitizers, and boxes and boxes, hundreds of boxes of gloves. We do still maintain a balance. We have some resources that remain. We show priority to first responders and to our healthcare workers. It is our intent to try to fill every request that we have. However, it's important to note that we are to provide temporary relief if these entities are unable to find resources themselves. We have 6 resource requests that we've sent to the state asking for more supplies. We received a very small order yesterday. It is not planned out well. We don't know when orders come. We don't know how much they're shipping until it arrives. As we extrapolate out the orders that have received and the balances that we have, it is our estimation that we have enough to last an additional 2 weeks. Beyond that, we exhaust our supplies locally. There's been a lot of interest on testing also. And it's important to note that the California Department of Public Health on March 20th released new testing recommendations. And they listed out 5 groups that should be tested. Hospitalized patients with symptoms should be tested. Residents and staff of long-term care facilities with symptoms should be tested. Those at high risk for severe infection with symptoms should be tested. Residents and staff of correctional facilities with symptoms should be tested. And finally, healthcare personnel with symptoms should be tested. Any person with mild respiratory symptoms who do not otherwise need medical care and are not in one of those above mentioned groups should not be tested. That is the recommendation from the California Department of Public Health. These individuals should provide care for themselves at home. And more importantly, asymptomatic persons should not be tested for COVID-19. We do maintain daily contact with all of our urgent care and hospitals that do provide testing. And just to give you a summary, this last weekend, Omni saw a decrease in their flow. They had 8 to 10 that were screened and only 5 were tested. They have a turnaround time of approximately 72 hours. Accelerated urgent care saw 20 to 30 patients this weekend and 12 were tested. Their turnaround time is 36 to 48 hours to get those results back. Priority urgent care saw 40 with 15 being tested, and their turnaround time is 24 to 48 hours. Kaiser screened 20. We're unsure how many they tested for this weekend, but their turnaround time is 48 to 72 hours. And Ridgecrest Regional has a specific testing procedures. I think it's a drive-through or a tent. They saw 20 to 30 that showed up. They test about 15 to 20 a day, and their turnaround time is 24 to 48 hours. All of those providers have indicated that there is no shortage of testing supplies. The county has also been preparing what's known as an alternative care site, or an ACS, which is designed to house symptomatic, suspected COVID cases or those that are COVID positive in the event that our hospitals are unable to provide that service any longer. If the surge capabilities exceeded in a hospital, we need to find a location to provide care for those that can't actually get into the hospital. We are designing the system to allow for the care of 250 people, scalable up to 1,000. And the idea is to have this operational by April 30th. All hospitals are required to have surge capabilities that will accommodate an additional 40% in their hospital beds. This ACS would be used if they reach that 140% occupancy at any one given time. Based on the modeling that the state is providing, they are planning for a 40% increase in capacity within existing hospitals and a total surge capacity of 67% across the state. And with the board's indulgence, Russell Judd, the CEO of Kern Medical, is here. I'd like to see if you could come up briefly and talk about the hospital's capabilities in Kern County.
Good morning, Madam Chairman and members of the board. So let me first start about the great working together that is happening across the healthcare sector in our community. All of the hospitals are united as we work together. There's an immense amount of communication. We're texting each other on a regular basis. We have a standing weekly call with all the hospital CEOs. That's formal, and then there's significant communication that happens just on an as-need basis throughout the week and through the day. Excuse me, as Matt mentioned, the governor has requested that surge plans be developed so that each hospital can go 40% above its normal occupancy to care for these patients. First and foremost, of course, that is the most limited resource is ICU beds. So each of us have identified a way to grow ICU beds. Most of those will happen in the post-anesthesia care unit where we typically care for patients of this significant disease. Ventilators have been acquired, beds are being acquired, IV poles, IV pumps, all the necessary elements to handle this surge of patients. From ICU, we go to just the regular med surge type patients, and again, all of those elements are being acquired, and we're moving forward to be able to handle the capacity. In my discussions with them, and not to speak for them, but we're regularly communicating. We're prepared with equipment, with supplies. The big question, of course, will be staffing those beds. We are developing a plan. We will not be able to meet the nurse-patient ratios that are established in California. That will be an impossible task, but we received word from the state that will be, waived is not the right word, but it will not be enforced. It'll be impossible for them to enforce that nurse to patient staffing ratio, but we'll establish a process whereby the appropriate care is given. Our physicians are being very accommodating to adjusting outside their specialty. I had a surgeon come forth and say, well, it's been a long time since I've not done surgery and just take care of medicine type patients, but I still remember basic elements. Our infectious disease specialists will give guidelines and others will go out and carry out those work. So plans are in place. I'm very confident that we'll be able to meet the need of getting to that 40% surge request as been requested, and the community can know that if the day comes where we're to that level of needing to open those beds, they will be open, care will be provided, and we'll be able to meet the needs of our community. So I can end there and answer any questions, or we can wait till.
If with your board's indulgence, could we postpone the questions, and we're almost finished. We have two more issues we want to cover, and then we'll turn it back to you. There has been a lot of discussion about information that public health releases or doesn't release on those that are COVID positive patients. The county follows a very careful guideline that's issued by the state, and we adhere to that to ensure we show compliance with state and federal privacy laws. And what I'd like to do is ask Bryn Kerrigan to walk us through a little bit of this discussion, and then I want to talk briefly about modeling.
Good morning, Madam Chair and members of the board. My name is Bryn Kerrigan. I'm your Assistant Director of Kern County Public Health. On November 22nd, 2016, the California Department of Healthcare Services issued the Data De-Identification Guidelines. The purpose of this 69-page document is simply to establish a process to ensure the data we release does not allow for the identification of individuals impacted and to ensure we are in compliance with federal and state privacy guidelines, including the Health Insurance and Portability and Accountability Act, better known as HIPAA. The guidelines clearly identify certain demographic information that could potentially result in the identification of an individual. With your indulgence, I'll ask Mr. Constantine to put page 18 on the screen. This is page 18 of the 69-page document. And looking at page 18 of the document, you will see that a point value is assigned to each variable or category of demographic information. The higher the point value assigned to each variable, the more likely one would be able to identify an individual based on the information released. The guidelines identify 12 points as the maximum acceptable total score for the appropriate release of data and to remain in compliance with privacy laws. It is important to note that once data is released within a particular variable, the data cannot be removed and we cannot add variables until our overall score is low enough. Releasing data of any kind includes multiple variables according to the guidance. With your indulgence, I'll ask Mr. Constantine to replace that document with some examples.
One at a time or all three?
Yeah, one at a time. So let's look at an example using the first positive COVID-19 case in Kern County. In the first example, you will see that the first variable is known as an event, and in this case, the event is a COVID-19 case. There's a characteristic assigned to the events, and since we had less than 11 events or cases, at this point we had one case, our score for this particular variable is 7. There's also a time frame associated with this information, and that time reporting period is less than a month in this case, so that adds 5 points to our total score. There is always a residence geography that's associated with it because we are releasing information at the county level, and the population of Kern County is within the characteristic of a population of 560,000 people to 1 million people, which lowers our score by 1 point. There is an interaction or multiple variables being discussed at this time, so we have a variable interaction category that needs to be also included, and at this time, with only one case, the variables that interact are the cases, the time period, and the geography of the cases within Kern County, and that adds 0 points to our score for a total score of 11. Remember, the maximum score is 12. So at this point, we are unable to release any further information with one case. Let's look at another example. Let's look at 5 positive cases of COVID-19 in Kern County. At this point, we have a number of cases within our variable of still less than 11 cases. So our score remains 7 within the events variables. We still have a time period of less than a month, so we still have 5 points related to our reporting period. At this point, we looked at different population densities that we could release the information at because we were receiving a lot of questions about where these cases were located. And so with a resident geography of population of 100,000 to 250,000 people, that adds 1 point to our score. At this point, our variable interaction category does change because we have 5 cases, and now we are allotted a -5 in that variable interaction category, reducing the availability or the ability for somebody to identify an individual because we have more cases. So our total score is 8 at this point. It is important to note that while our overall score at this point is currently 8, which is 4 points below the maximum score of 12, any additional variable significantly impacts the variable interactions category. Let's look at an example of 5 cases releasing data in 5 regions with population densities of at least 100,000 people. This would be example number 3. Specifically, if any additional variable changes are added, the score in the variable interactions category increases from -5, as we saw in the last example, to a score of +1, which essentially adds 6 points to our overall score. This does not include the added points for the variable category that we want to also include in our data release. In this case, adding an age range variable in increments of greater than 10 years adds an additional 2 points. The total score in this scenario is 16, which exceeds the maximum allowable score and is non-compliant with state and federal privacy laws. Once the county reaches 100 cases, we will be able to evaluate adding an additional variable at that time. Vice Chair and members of the board, that concludes my comments, and with your indulgence, I'll turn it back over to Matt Constantine to conclude our presentation.
Thank you.
On Friday, the California Department of Public Health released some modeling data that they distributed to the counties for consideration. That modeling data, they referenced some educational modeling programs that have been sanctioned by the state, and they've included some variables that we should add in. They helped us to refine California variables into this model. This model is helpful to us, and if we could go to the first graph. So as we look at the modeling data, what we have recognized immediately is social distancing plays a dramatic role in the census, the number of individuals, COVID-positive individuals in a hospital. So the first graph, the blue, shows what 30% social distancing does. The state told us we should use between 30 and 70%. This means that 30% of the time you have changed your behavior and you're adhering to the recommendations to provide that distance between you and somebody else. At 30% social distancing, you can see the census dramatically increases over a short period of time. If we increase the variable of social distancing to the mid-range that the state is telling us we should use, you see a 74% reduction in hospital census, and it also delays the onset. If you go to 60%, which is still below the range that the state has provided, you see a 97% reduction in hospital census. As we look at the last graph with the same data, what you see here is there is a significant delay in the onset of that bell curve. So at 50% social distancing, the length of time for that peak to hit is 2.6 times greater, meaning we have time to prepare, we have time to secure more resources, we potentially have time to allow for a vaccine to take place. And at 60% social distancing, you clearly see that we are even now below the maximum capacity of a hospital. You see 2 lines. The first one is the green line, which is the normal hospital capacity, and then the red line that Russell Judd spoke about, that surge capability, we remain below it at all times. Now, this is the flattening of the curve concept. It extends the duration of the illness in our community, but it allows us to be prepared and to be responsive and to ensure that more people survive. The takeaway from this is the same message that we always end most of our conversations with. Social distancing matters. staying away from people that are sick. When you're sick, stay at home. Heed the governor's recommendation and the California Department of Public Health's recommendation, which is stay away from businesses that allow people to congregate, stay away from those gatherings. Heed that advice, because it makes a dramatic impact not only in your health, but the health of our community and the ability of the hospitals to actually respond. Madam Chair, that concludes our formal comments. We are certainly here to answer any questions you may have.
Well, thank you, Matt, for what is very practical advice for us to be able to do and apply and have within our power and control, right? Social distancing, something that we can do and within our power. I really appreciate your presentation. I believe we're going to have some questions. We also have some comments from the public that our clerk will read into the record and hopefully will be considered today if appropriately managed. Okay, so colleagues, I'm sure you have questions. I see that Supervisor Couch has punched in. Supervisor, the floor is yours.
If there are public comments, I'll wait for those to be read. Thank you.
I prefer to wait.
Yeah.
Actually, Madam Clerk, we did not receive any public comment related to item 25. We do have public comment related to item 11, public presentations, which we will take up next.
I see. Thank you so very much. Supervisor Couch.
Mr. Judd, this might be for you, you or Matt. I was asked the other day if we have a plan to essentially isolate COVID-19 positive patients at any one particular hospital, or are they just how are we selecting which hospital a patient that tests positive that needs to go to the hospital would go to? Better question.
The majority of people who present to at a hospital walk in.
Okay.
And so that's left to the public. The publics have their choice of their hospital. Most often they go to their nearest hospital when they're sick. So we've had that discussion. Transferring a patient, if a positive co-ed patient landed at hospital A and we says, no, let's move them all to hospital B, you put a lot more people at risk during that transport and exposure. And so any particular plan to go to a particular hospital is just not feasible.
Okay, that answers that. Thank you. Mr. Constantine, I was also asked if we can, and I don't think this is one of the categories you just described, if you could tell people essentially how many of those positive cases are within particular households. In other words, multiple cases within a household. Are you able to make that public as well?
So Supervisor Couch, through the chair, the answer would be no, because then we are further identifying an individual. I would also state that it is not relevant to the community as a whole. We need to understand that COVID-19 is likely here. It is being spread through our community person to person. We need to change our mindset to taking action to limit or reduce that spread. Where a positive case lives is not necessarily helpful in the control of the disease at this point.
Okay, do we know yet if you can test, is there a way to know that you've been positive? Whether you were asymptomatic and no longer have the virus, or if you were testing positive, you have the virus?
Yes, sir.
Once the virus is gone from you, you're not going to test positive anymore? Or is there a test that will show that you had it?
So I don't believe you will test positive.
Okay. Are we able to tell the public how many, and I'll call them cleared cases, people that are no longer symptomatic for whatever amount of time the medical professionals say
So
is required to not be contagious anymore?
Those that are testing positive,
Yes.
those that cleared.
Yes.
Is that the question?
Yes.
So in almost all cases, either by themselves or under hospital care, recuperate.
Right.
Unfortunately, we had one case that did not, and that person died. Eventually, and it varies widely, everybody recuperates. So to be able to tell you on a daily basis how many of those and how you determine when they're now deemed healthy is variable, and it's difficult.
So when a doctor says to the patient, you are now, Do they test them to see that they're no longer positive?
I might defer to Russell Judd. I don't know firsthand information about the actual testing protocol at the end of the disease. Or, Kim, do you have any information you can offer? I'd like to ask Kim Hernandez. She is our lead epidemiologist, and she's in charge of our disease control program, to come up and see if she can't offer some insight.
Good morning, Supervisor Couch through the chair. The short answer is that there are CDC guidelines which determine when a person is released off of isolation for their illness. It includes a number of factors, including whether or not they are still experiencing symptoms, how long it has been since the onset of symptoms. The CDC has two mechanisms for clearing a person. One of them does include testing them to ensure that their test results are negative. Another process, because of the limitations and the turnaround time of testing we're currently experiencing in the United States, includes not testing a patient for cure, but following their guidance that says if we meet certain criteria, the likelihood of this person still being infectious is small, and releasing those patients for isolation. If I could go back to your former question, at this time there is no FDA-approved test to see if you have been previously infected and are now past that infection. That is something that a number of people are working on because that's an important question. The current testing right now tells us if there is a current infection or at least detectable virus in a person at that time. Whether or not that person is still infectious is subject to which test you're using and the interpretations of those tests.
Thank you for that answer. I have one more for you, a little bit of a follow-up.
May I ask a follow-up really quickly,
Yeah.
Supervisor? Thank you. What do you know about reinfection? I mean, I've read some about it. There's a lot of data out there. It's quite alarming and confusing.
Certainly. At this time, there is no indication that a person can be reinfected with COVID-19 based on what we know of similar coronaviruses. They don't expect that people can be. It is still something that is being evaluated and looked into. For the moment, once you have been infected with COVID-19, you are considered, at least in the short term, immune to additional COVID-19 infections.
Got it. That's certainly the hope. Thank you. Would you keep us updated on that particular issue, as it's obviously super relevant?
Certainly.
Supervisor Couch, thank you.
Thank you. If someone tests positive and they go through they're sick, for lack of a better term, for a certain amount of time, they get better, they're tested, is that test included in your numbers, the second test?
No, sir. We would not include that in the number of cases because we're counting the number of cases.
Cases, okay.
Yes, sir.
Excuse me. And lastly,
Could you repeat that? I didn't catch that.
if a patient tests positive and they're sick and they get better and they're tested and they are negative, that second test is not counted, correct?
Yes, sir.
In your raw numbers, your data that you're releasing.
Right, we're reporting out on the number of cases, and so we would not be counting those follow-up tests if they are performed as part of the number of cases.
Whether they test negative or positive,
Yes, sir.
they're a case, not a test.
Right.
Okay. Thank you.
Dave, thank you.
Yeah.
I would just make sure I understand. So you mean when the patient tests that they are recovered, that test is not counted in this number? Is that what you're saying?
As a negative.
Correct.
Okay, thank you.
Thank you. Lastly, I would just make a comment that Supervisor Maggard and I had a conversation the other day with a man, a local guy that you would all know, that was very interested in helping however he could. I'm sure there are other people that feel the same way. I think I remember him saying he didn't feel like he could do a lot, but he could write a check if it was needed. So I know we have the Kern County Foundation. If there are other receptacles that we could use for contributions that the public would like to help out, whether it's for PPE or whether it's for just helping people that need help in some way with a meal or with anything.
Rent?
There are rent, for example. Yeah, there are people that are willing to help, and I'd like to.
That's awesome.
I'll just refer that question to the CAO, and we can have a discussion about that later. Thank you. Thank you,
Thank
Madam
you,
Chair.
Supervisor Couch. That's incredibly gracious and smart. Supervisor Maggard.
Thank you. I have a few questions. I don't know whether to ask some of these things on item 25, which is our report internally, or now, so I'm going to ask now, maybe they'll come up again. Is there a mathematical way for us to predict how the wave will hit California and Kern County based upon the progression of the disease through New York? And is someone telling us that so we can anticipate when we need to be prepared?
Supervisor Maggard, through the chair, I'm going to defer to Kim Hernandez again, see if she can provide us some guidance.
Thank you. Good morning.
Supervisor, through the chair, thank you. The short answer is that there's a no magic number. You know, this is changing on a constant basis. This is something at a state level that is being evaluated constantly. There are some stark differences from what we're seeing in California as well as New York. One of the biggest things is that California unfortunately had a bit of a head start on looking at COVID-19 and preparing for it as the West Coast was first impacted, you know, particularly through the return flights from China, as well as some of the repatriation from the cruise lines. And so California has been looking at this very closely and evaluating all of the different interventions that can be done and to prepare. So we don't have a set date. Everything we're hoping to do pushes that date back further so that we mitigate the risks in all of our communities. We are preparing. We have been watching closely in Washington as well as New York of what happened and learning a lot from the communities that have been unfortunately affected very heavily. We're also looking at our peers in the Bay Area as well as Los Angeles County about what they are experiencing and the level of impact it's having on their communities. So unfortunately, I don't have a good, simple answer for you, but it's something that is consistently being watched and reevaluated, and at a state level, they're continuing to make guidance based on what they're finding.
Mr. Hernandez, this isn't your fault. I'm not focusing this at you at all, but I'm frustrated that there isn't a way, there must be a way to look at the progression of, if we have 82 cases today, when will that become 164? When will that become 328? How does that number grow? How has that occurred in other communities? And I think that's something that would be helpful for us to know. So is somebody someplace, have you read anywhere that anybody's done something like that?
We're definitely looking at, you're talking about the doubling rate, which is what everybody is using as part of the metrics in the modeling. We are early in our progression in Kern County, and that's something we're continuing to look at. Obviously, it varies widely early on because we might, in our very first day, we get one case, and then the next day we might get 5 and go back to 1. So we're waiting for that to become a little bit more consistent for us to be able to see what our local doubling rate is, because that's an important piece of all of the modeling data that's available to us now.
Okay. Thank you. The reason I'm asking that question is this. I think we need to be thinking a couple of steps ahead. So if we have 2 weeks supply of gowns, masks, and eye shields, that's rather daunting. That 2 weeks is not that long. So should we be thinking now about what we do with that limited supply? For example, this is not an internet thing. I see national news discussing using full-face snorkeling masks as a way to protect people from this, and they can be used over and over and over again. And so should we today be anticipating how we can obtain those full-face snorkeling masks or have them made? 3D printers are producing them across the country. I'm interested in how we're thinking ahead about that so that we don't have to use a consumable item. We can use the same item over and over again. What's your reaction to that, please?
Supervisor Maggard, through the chair, yes, to answer your question, yes, we should be thinking about all of that now. We can't depend on the state. We don't know when those supplies will be issued. It is sporadic, and it does not allow us to have a strategic approach to this problem. So we should put everything on the table now on what we need as a community. We need to prioritize the supplies that we have now, and we need to focus on what's the most important and find every resource available to us now. Yes, sir.
So if there are local companies that have the ability to produce with 3D printers and the right supplies, those kind of things, it seems to me we should be talking to them about can they help us so we can be prepared and not wait for someone else to decide how many we get. I'd rather us find out how many we can produce. So that's one, same principle, different element of supply here. What about the gowns? I understand there's there may be a way to scrub these gowns and use them more than once. Are we beginning to do that now? Are we prepared to do that so we don't burn through all we have and have a limited number that we can clean later?
Yes, sir. So the gowns is one of our areas of weakness. They are meant to be disposable. They are not meant to be washed. That's how they're approved for use. I think we need to, again, look at all options to try to find more gowns, especially for hospitals, as they are also struggling.
So what do we do when we get to the end if there aren't enough gowns? Do we just use them more than once?
Supervisor Maggard, I don't have an answer. I'm hopeful we don't get to that point, as that's not how they're designed to be used, but if we need to take every action possible to protect our healthcare providers.
And the reason that particularly the gowns is of significance to me is that, and I want to pause for a second and thank all the people who are first responders, firemen, sheriff's deputies, ambulance drivers, nurses, janitors in hospitals, doctors, everyone who is putting their face in the face of other people. I want to tell you how grateful I am that you're willing to do that to protect all the rest of us. So thank you very much, everybody out there that's doing that. And we'll talk in a moment about our staff, but I'll give the same gratitude to our staff that's doing that. But if our medical staff gets sick, they're the only line between us and this disease. So how do we make certain that we are protecting them? I guess I'm not satisfied today. This is not a criticism of any of you. I'm not satisfied today that we, as a culture, are doing enough to protect that. So I'm interested in what creative thoughts there are about how to accomplish that.
And Supervisor Maggard, understand that our supply doesn't necessarily represent the supply in the hospitals. So they have resources available, they have purchasing abilities available. So I will work with Russell Judd and his colleagues and the other CEOs to determine their volume and their capabilities and their time periods to see how that adds to the whole system.
I suspect there's a latent inventory of these things in many doctors' offices. If you're a gastro doctor and you aren't doing gastro work right now, or you're a dentist and, do we have the ability to have people volunteer to give us that? Do we have the ability to procure them involuntarily if necessary to make sure that there are enough in those hospitals to protect the rest of us?
I will evaluate all options, sir.
Okay. The reason that this extrapolation is so important is if we don't meet for 2 weeks, I don't want it to, expand it into a full-blown surge, and we aren't prepared to make the calls that are necessary. So if there are administrative decisions that we need to make that enable you to make decisions, I want to be posed with those policy questions now or in an emergency session soon hereafter, so we can give the clearance to allow you to move and not wait for the bureaucracy of government to make this slower, okay?
Understood. The ratification today of the health proclamation will aid in that approach, but I hear you. Yes, sir.
Okay, thank you. Are there any hospitals, is there any hospital space, excuse me, available at our military bases?
So Supervisor Maggard, the answer is unknown at this point. Supervisor Gleason's mentioning China Lake is no. We'll have to talk to Edwards also.
I'm asking this question because as I discovered last evening, somebody shared with me an article that apparently Fresno County is attempting to use fairground space for their expanded alternative care facility. And apparently there's some pushback from the state about that being feasible or not. So are we looking at, is ours subject to the same flaws Fresno's is? And are we looking at what alternate sites there are?
Supervisor Maggard, through the chair, those are not the same types of arrangement. That was a federal proposed location, and the state disagreed. The proposed site of our alternative care site at the fairgrounds is still valid and is still moving forward.
Okay, thank you. if something happens, I don't know how much more space we'll need, but, you know, there are gyms, big box buildings that are empty. There's all kinds of alternatives for us. I just want us to think ahead about that. Lastly, about this thinking 2 steps down the road, do we need to authorize now the rehiring of specific employees, whether they be nurses, physicians, firefighters, deputies? Should we authorize now the rehiring of them and change any of our policies if we need to backfill our frontline people if, in the event that they become ill?
I think we need to do everything possible now. Our immediate concern on a county level is staffing this alternative care site. I do not have adequate staffing to accomplish that, and that is a concern for us as the target of April 30th looms. So I think every potential ability to bring back additional people with that background should be explored.
So, Mr. Alsop, our emergency declarations, I suggest, need to have language that will enable us to jump across certain of those lines so that the bureaucracy of our hiring process doesn't hinder us from hiring people as quickly as possible.
Yes, sir. That's the intention of the emergency declarations, and we'll be working with all of our departments and our human resources personnel to address any needs that they may have.
Thank you, Mr. Alsop. Ms. Rezan, are you confident that we can not be stuck in our own bureaucratic line, or can we move quickly enough?
Supervisor Magrid, through the chair, we should be able to move very quickly. Both locally, we're looking into it, and there's a number of executive orders from the state, from the governor, that allow for quick rehiring of retirees and other staff.
Okay. May I have more questions? I'm sorry that I'm so focused and directed on this, but I appreciate your indulging me, and please let us know if there's anything we can do to get out of our own way here to make sure this happens. Thank you. Thank you.
Supervisor Magrid, thank you for your excellent questions. Supervisor Gleason.
Thank you, Madam Chair. First thing I want to do is take off a little bit on what Supervisor Magrid said and make a pointed thank you to all the people in this community who are involved in healthcare and are working diligently to support our constituents. I mean, they're doing a phenomenal job. Not only are the healthcare people doing a great job, the nurses, the doctors, the sheriff's department, fire department, anybody who's involved. I'm sure if I list them, I'll miss a bunch of them. But I'm seeing fewer people on the streets. Every day it seems like there's less and less people on the street. I think the message is getting out there, and I think the population needs to, I bet there's a lot more people watching this program today than ever before. Mm-hmm. And I want to thank all of them and everybody who's been involved in trying to curb this spread of this disease and flatten this curve. So, Ms. Constantine, you said we have 82 positive cases.
Yes, sir.
7 have been hospitalized.
Yes.
That means everybody else who caught the disease did not have to go. The degree of challenge of that illness didn't warrant them going into the hospital.
They recuperated at home.
Great, that's good news. What's the average length of stay of a hospital admittee?
Somewhere between 7 and 9 days is the state average.
Okay. We talked a little bit about the doubling rate. Kim, you talked, Ms. Hernandez, you talked about the doubling rate, and you said we don't have enough information yet to determine when we will be able to predict. Where are we now in understanding where that point is that we'll be able to predict the doubling rate? Sorry to have you walk all the way down here.
Supervisor Gleason, through the chair. We're getting close, to be completely honest. We want to make sure that this rate is stable and they're not having wide fluctuations. A lot of this is unfortunately due to the testing limitations that have affected the entire nation, is that we are getting sort of chunks of results back at a given time instead of it coming through steadily, which is how we experience most other diseases. And so we are not confident at this time that the numbers that we're getting are are a good representation of actually the infections happening in our community. So we're waiting for a couple of things to stabilize, being one of them the number of tests we're getting back and the timeliness of those tests. We've had a lot of concerns from a number of our constituents in our community saying, it's just taking a long time for the results to come back, which we, unfortunately, the Public Health Department don't control. We are depending on a lot of our commercial laboratories who are working very hard, a lot of other public health laboratories throughout the state who are working very hard to get them back as quickly as possible. But until those results come back a little bit more consistently, and until we see some stability in the number of cases that we're seeing in our community, it's difficult to predict that doubling rate with confidence. And so we want to make sure when we start saying how quickly this is happening, that we have good information to give the public.
Are you going to give me the same answer if I ask you to speculate on when you believe the apex will occur in Kern County?
Yes, sir.
Okay.
A lot of that's going to change depending on what we do. If we take action now, we will expand the amount of time it takes to reach whatever apex we hit. And so we encourage people to take those steps right now so that we can, flatten that curve as everybody's talked about and expand the timeline to give us more time to prepare, more time for all of the interventions to work, and to ensure that our healthcare system is ready to take that on.
As an resident epidemiologist for Kern County, what is your sense of confidence that Kern County is moving in the right direction and that we're not forgetting to do anything and we're doing everything we can to flatten this curve?
I think as a community, we are preparing very well. We have asked everybody to take personal responsibility and to make good choices and follow recommendations. And from what we see, we can all see it as many of us still have to drive into work every day, the amount of traffic that has reduced because people are staying home. In our own personal lives, if we are evaluating ourselves and saying, have I changed my habits in accordance with these recommendations, then we can each feel with confidence that we're all doing everything within our power to reduce transmission in our community.
Mr. Hernandez, is this virus seasonable?
We do not know. Unfortunately, because the first identification of this virus happened late last year, we do not know at this time if there will be any seasonality to it, similar to the way we see flu have a seasonality. We're not sure. The CDC has stated that they are preparing for this to continue throughout the warm summer months. And so everybody is hoping that there's some seasonality to it, that we will see some decrease soon, but we don't know for sure, and we need to prepare as if it isn't and continue to take those steps as if this is going to continue happening in our community.
Thank you.
You're welcome, sir.
Matt, let's talk about the testing for a second. Not the process of testing, but the test kits themselves. I heard recently that they're significant. Everybody's weighing in this. Ford, General Motors, General Electric, all these companies are, all of American industry and innovation is pouring into developing these new capabilities that help us flatten the curve. So could you talk a little bit about what you know about new tests and when we're going to get these new tests so that we can have results in 5 to 10 minutes? So do you have any answers to that question?
Supervisor Gleason, I do not have any more information than what we also read in the media. We've been monitoring it carefully. However, as you have heard us say, the state and others are starting to de-emphasize the testing for the general public. So the demand will diminish. But obviously, if we can get results back quicker, that allows us to respond quicker.
Are you completely satisfied with the communications you're having everywhere in the universe with regard to getting what you need to help answer the questions for Kern County?
Yes, sir. As it stands today, yes.
Any problems with the state, with the feds, local agencies, anything that you're having issues with that we can help you with?
Resources.
Let's talk about
the
that.
State. Sure.
Let's talk about that. Let's talk about resources. Let's talk about logistics. Let's talk about communications associated with those logistics. How's all that going?
So as it relates to PPE, that's my target right now. We put in resource requests, and they sit. I'm certain they're getting bombarded with all the other counties.
To whom do you put these requests?
It goes to the
state CDC.
It goes to the Office of Emergency Services,
Okay.
Cal OES, and those requests go up. And as they can, they respond and they send orders down. It is difficult for us to plan strategically. The other day we had a semi-truck arrive with 23 pallets of supplies. That's terrific. They've since been almost all distributed, but we didn't know it was coming until the very end. We were told yesterday there was another whole load coming, a whole shipment coming, and it was one tiny little pallet in a giant semi-truck. We don't know that until it arrives. We don't even know what's in it until we open it. Obviously, there must be limitations on their end, but it makes it very difficult for me to, when I get requests from hospitals, to know when I'm going to be able to fulfill them. So it has been a challenge. That is not a logical, strategic approach to a problem. So we struggle with that. We're grateful they come, but that's a problem.
So you mentioned earlier that you provide PPE for hospitals, and I think I understood you to say that these hospitals have normal vendors.
Yes.
That provide
Yes.
these PPE equipment. You were providing an interim or
Yes.
a fail-safe kind of process just to get them through the month?
Yes, sir.
So do you have available statistics for all the hospitals in Kern County that their stockpiles are satisfactory?
I do not, and I don't believe they are satisfactory based on their orders to us.
But we are every order you're meeting.
As I can. I'm not able to always fulfill them. And we also get requests for resources we don't have, we don't stock. And from non-first responders and non-healthcare providers, we generally don't fulfill those.
So all these hospitals have their normal vendors. Maybe
Yes,
I should
sir.
be asking this to Mr. Judd, but they have normal vendors and that they work with. So once they reestablish those relationships, we're kind of not going to be in that business anymore. Is that correct?
That's correct.
We're just a stopgap measure.
A fail-safe, or it's the last group that they can come to for help immediately.
So when these hospitals get back on their vendor schedule, it's not our responsibility to fill their
No, sir.
stockpiles.
No.
It's their vendor's responsibility. But we're still going to be there building our stockpile to provide surge capability for these hospitals that may have problems
Yes,
down
sir.
the road with their vendors, their
Exactly.
normal logistics.
Yes, sir.
Okay. Can I talk to Mr. Judd? Mr. Judd, you said earlier that you're satisfied that all hospitals in the community are working together. And when you say community, you're talking about all Kern County?
Yeah, all 10 hospitals in Kern County. So Ridgecrest, Tehachapi, Delano, all the ones in the greater Bakersfield area.
Delano? Yeah, okay, good. And all you CEOs, I think you said something, you're maybe not every day talking with every one of them, but it's a free-flowing information and everybody's working together to satisfy their needs.
Yes, that happens on a regular basis, it's free flow, and then every Wednesday evening, we have a structured call that we go through, communicate, share issues.
Who
and
leads
concerns. Right now, it's been led by Ken Keller at Dignity Health. He is the chair of the California Hospital Association in our area.
Thank Ken for us.
We absolutely.
Appreciate what he's doing. He's all over this, and I've heard his name come up a couple times, like many of you guys are stepping out, doing a great job. What do you know about new tests?
So testing is very difficult. At Kern Medical, we are working to try to bring some of those tests in-house. If we can get the reagent, which is the testing mechanism, we hope to have that up and be able to do local tests in about 3 weeks from now. But not just getting the tests, but it's almost impossible to acquire that reagent. So if we can bring that in-house, I know Memorial Hospital is also in that same path, trying to secure reagents so we can do that test in-house.
Outstanding. Thank you, Mr. Judd. Appreciate it. Last area, a question, and I'm done. Reporting. I understand, and you have convinced me completely that you are complying with mandates on reporting to protect certain individuals and their rights to privacy, and that's good. But it sure would be nice if we could understand, for the betterment of the community, that, like we had a pocket of virus-infected people in, this place. So it would help us manage the community better than just, if not knowing that. For example, on a larger scale, the mayor or the governor of Rhode Island is preventing people, not preventing, but people from New York coming in saying, okay, you got to promise you do a 14-day quarantine if you want to come into my state. I'm not saying I agree or disagree with that. I know it's very controversial. But it's data and decisions that are being made to protect our people. So there's a balance that we've got to manage between complying with regulations and managing privacy rights, which I'm full-heartedly endorsing, and still at the same time using the data we have to the best possible use to prevent as many deaths as we can possibly do. Could you talk about that for a second?
Supervisor Gleason, with respect, I disagree. I don't believe that it's helpful to know a house or a street where somebody is positive. COVID-19 is in your community now. It is likely being spread through the community. It does not help to focus on a certain location. It is here. We all need to take protections. A 20% reduction in your social distancing or your social activities dramatically, it's a 74% reduction in the number of cases. That's what matters. Our focus should be not on where people live that are positive, but what we should do as a community to address it. Just because your neighbor was positive doesn't mean your other neighbor is not. It just means that they were tested. Not everybody's tested. 80% of those that are affected have mild or moderate symptoms. Most people with those symptoms may not get tested. They likely don't. So it is not an appropriate assessment of the COVID activity in our community. What we're going to tell you now is that testing doesn't help much any longer for the general population. We need to take action now, and it doesn't matter where those individuals live.
So the frustrations people feel when they see other counties
Yes, sir.
reporting by community, and the fact that we're not, is because they not complying with, or are we complying, or what? What's the difference? Why are they doing it? We're not.
Other counties are appear to be adhering to the state guidance document as we are. There are others that appear not to be. I can't defend their actions. My job is to protect the privacy rights and to remain in compliance here locally, both so that the county is not sued for violation of those rights, but also for the ethical purpose of it is their rights to not be disclosed, not to be identified who they are.
So what you're telling me is that the fact that I live in the mountain, or I live in the desert region, and I live in the far north of the desert region, and the desert region is reporting 2 cases of positive test results, it should not concern me at all whether those persons are from my next door neighbor or 100 miles away down in some other place in the border of LA County, because the disease is here, it's moving around us, and whether that one particular case was found way down 100 miles away has no relevance to my behavior and how I should behave in managing the spread as we move forward.
Exactly.
Okay, thank you very much. I'm done and appreciate the clarity.
Madam Chair, may I piggyback on that question? So I can live with that. But if store XYZ has a problem, how does the public know that store XYZ has a problem so that people don't frequent that store or they wait till that store's been cleaned up?
Supervisor Maggard, through the chair. So Kim Hernandez and her colleagues spend a lot of time talking to every positive COVID case. They assess all personal close contacts and all household close contacts for the potential that any of those individuals may be affected. They talk about where they work, they talk about their community events, they talk about their behavior, they assess the risk. If they believe that there is a risk that they can't define, let's just take, for example, we have a teacher that was in close contact with some group for some certain amount of time. If we believe that that occurred and we can't identify those individuals, we will go to the employer and potentially even go public with that information. We too have seen information in the media about where self-disclosed COVID positive people have worked, and the perceived risk. If our epidemiologists have not deemed that as a risk, we have not taken action, and there is no risk. So without trying to disclose too much about an individual, the assumption that can be made is that those locations are not at risk. It takes prolonged personal contact to likely transmit the virus.
Is Ms. Hernandez a physician?
No, sir.
I just don't want to not call you doctor if you're supposed to be a physician, so I'm sorry for that, Ms. Hernandez. So is the person who makes that decision on whether or not other people have been exposed Ms. Hernandez?
It's her and her team, yes, sir.
So if there's some speculation, say there's speculation about a doctor, and that doctor saw 25 patients in the last 3 days before that doctor became ill, are those 25 patients contacted?
If we believe that the potential of disease transmission existed, the answer is yes.
So people can be assured that if somebody with all due diligence, like Ms. Hernandez is reviewing it, if they were exposed, somebody would tell them that?
Yes, sir.
Okay, thank you very much. Thank you, Mr. Gleason.
Thank you very much. So Supervisor Gleason, thank you. Come back to you if you have further questions. Supervisor Scrivener.
Thank you, Madam Chair. First of all, I have a question about process. When we go to item number 25, is that when we're going to hear from other county department heads? Is that okay? So I have some questions that I think I'll direct at some of the other county department heads specifically, rather than bring them up now. Matt, first of all, I want to thank you for the amazing job that I think that you and your team are doing. Obviously, everyone who's on the front lines of this, all of our healthcare professionals, our public safety professionals, all of our other employees that are essential functions are just doing a fantastic job. And I want to also thank you for taking all my calls and all my questions. I know how overwhelmed you must be, and so believe it or not, I have tried to limit how much I am contacting you. The different hours of the day, the weekends, and everything. I know you're working 7 days a week on this. But I do want to just hit on something that has been discussed by a couple of colleagues, but it's probably what I'm hearing the most about from my constituents. My district, as you know, is vast. It's 3,660 square miles. It's about 42% of the land mass of the county. And so what I hear from folks that say live in Tehachapi or live in Boron or Rosamond, when they see there's 2 mountain cases, there's 2 desert cases, they're frustrated, and as you see that for lack of a better term, that ticker continue to increase as far as how many cases you have, the anxiety level grows. Where is it? Is it getting close to me? Et cetera. For a while, I think folks were saying, well, it's not here yet, it's down there, it's in Bakersfield, et cetera. But I think that your point is something that needs
affected disproportionately. And we've seen some recommendations from the state saying that those that are older should take stronger actions. At this point, that seems to be a logical approach. The state has now started releasing COVID positive cases based on broad age ranges. We want to wait until we reach that point. And as Brent indicated, once we make that last decision, that's all the data that we can release. So it's a one-time kind of action. We got to be very careful what we do.
That will be the last demographic decision you get to make about that chart.
Yes, sir.
I see. Okay. Thank you.
Supervisor Couch. Thank you, Supervisor Maggard.
Thank you. 2 more questions. One is, I'll hold my questions for our departments, our intra-government issues for item 25, but outside of the departments that are represented here today, for example, is MCAB, Emergency Medical Care Advisory Board. So a time is coming when I suggest, when a decision needs to be made by the ambulance driver as to which hospital a person should be delivered. So the ambulance driver who has his hands on the steering wheel is going to make that decision. I'm being specific for the public's benefit. That'll be some telephone, radio conversation with a doctor and a ER who says take them here or there or wherever. So do we need to change any of our policies or procedures? Do we need to anticipate now how to go about doing that so that we can deliver those patients to the appropriate hospital depending on what level of capacity they have?
Supervisor Maggard, through the chair, the paramedics that are making those decisions are trained and tested on those decisions, and the system works as it's designed today. As that system becomes stressed, as hospital capacity is reached, as we reach into surge capacity, that environment changes. So I think you're wise to think in the future, and how can MCAB provide some additional tools so that we make sure that we spread those patients across the services, the 10 hospitals that Russell Judd mentioned, so that we can make sure they get the best care. So I think it's wise to make this an item and a discussion point at MCAB But as the system stands now, it works well.
When does MCAB next meet?
May 14th, sir.
Boy, that's eternity in the
We can
world we're
call
living in,
us
so,
be a meeting much sooner.
okay. All right, I'm interested in that. Last thing for thinking outside of the county operation. I'm a grocery shopper now. I've avoided grocery stores my whole life. I used to work in one, and after that I didn't go back. So I don't go often, but I go now. And it occurs to me as I'm bringing those bags of things in my house, how do I do that safely? So is there some tutorial? Is there some guidance? If we put something up on KGov that would help people, what can you leave in your garage for a few days so that the virus is dead before you bring it in your house? Those kinds of things, I think it would be helpful for the public to have something that will tell them, and I don't want to trust, some yokel on Facebook telling me how to do it. I want people to know what they're doing to tell me how to do it. So can we come up with something to tell the public how to protect themselves that way?
Yes, sir, and it extends far beyond just grocery shopping, but daily behaviors, daily actions, hand washing, ensuring that your family's protected. So absolutely, we will do that.
Okay, thank you.
Great ideas, Supervisor Maggard. Supervisor Couch.
I don't know that you mentioned it, and I didn't hear it. If you did, I apologize. But all I've heard about on the news lately is the number of ventilators. How do we stand in Kern County at various hospitals? Do we have those in stock? The county? Where do we stand on that?
So Russell Judd, maybe to offer his insight, each hospital reports out daily for us on the number of ventilators and ICU beds and normal beds they have available. We also have a stockpile of ventilators ready to be deployed if needed.
How many do we have? Do you know?
42.
The county itself?
Yes, sir.
Okay, and then Russell, could you comment on what the rest of the hospitals have?
So that 40% surge capacity, that's part of the intensive care unit. There are enough ventilators in Kern County to meet that need. You've got the extra 42 that Matt just mentioned. In addition, through our emergency preparedness, we have these very unique ventilators. It's a single ventilator that you can attach 4 different patients to. It's used in an emergent situation. So
4?
I think, yes, it's got multiple circuits. So I think at this time.
So I've heard people, I'm sorry to interrupt, but I've heard people back east talking about they're going to try out putting 2 people on a ventilator. You've got one that you can put 4 patients on one ventilator.
Yeah, it's specially designed in this for this emergency type situation.
Thank you.
So I think we're okay on ventilators.
Supervisor Couch, Bryn's just pulling up. The hospitals are reporting a cumulative normal non-surge capability of 235 ventilators, not including ours and not including the surge capacity, the 40% surge capacity.
Thank you.
Thank you. Supervisor Maggard, back to you. No, I just had a good question. Excellent questions. Thank you. I'm going to turn the microphone on now. I think that would help, right? Clerk, thank you. Madam Clerk. Okay, so no other questions from the dais at this time, gentlemen? Okay, I'm going to proceed then to public comment. Kathy? Okay, got it. There is no public comment. That's correct. You said that. Thank you again for that reminder. We will move now for...
Motion to approve, adopt the resolution.
Thank you,
Authorize
Zach.
chairman to sign.
Second.
Thank you. We have a motion and a second. Please cast your votes.
The motion is approved. All ayes.
Okay, we're going to move to public presentations. Kathy, with your permission, is that correct? Thank you. So on to page 3. Item 11 is public presentations. This portion of the meeting is reserved for persons to address the board on any matter not on this agenda, but within the jurisdiction of the Kern County Board of Supervisors. Traditionally, we take public comment from the public right at the podium with a limited 2 minutes. Today is different, of course. And so, Ms. Kraus, I'm going to give you the floor at this time so that you can convey to the public the information that needs to be known under our changing circumstance. Thank you very much.
Thank you, Madam Clerk, thank you, Madam Chair and board members.
You're the real chair, Kathy,
there we
so
go.
that's okay.
So we have received, we've received 3 letters that I'm going to read during public comment. We've also received 2 voicemails, 2 voice messages. So I will go ahead and read the correspondence, and the board will hear, and the public will hear the 2 voice messages. So the first letter we received comes from, it's a joint letter from the Bakersfield Association of Realtors, Kern County Taxpayers Association, the Greater Bakersfield Chamber, and the Kern County Hispanic Chamber of Commerce. This first letter is regarding emergency ordinance on eviction moratorium. Dear Chairperson Perez and members of the board, the undersigned organizations respectfully submit comments pertaining to Special Agenda Item 1, an urgency ordinance temporarily prohibiting evictions of residential tenants. Our organizations represent companies that have operations or conduct business in Kern County. We are very sympathetic to the health crisis that is occurring. Our memberships have been significantly impacted, but we are all in this together. The governor issued an executive order on March 27, 2020, banning the enforcement of evictions for non-payment for renters affected by COVID-19 through May 31, 2020. The order requires tenants to declare in writing, no more than 7 days after the rent is due, that the tenant cannot pay all or part of their rent due to the stay-at-home. All federal agencies, HUD, Fannie Mae, Freddie Mac, VA, VHA, FHA, have suspended all foreclosures and evictions until the end of April to help those most affected by COVID-19. The executive order does not relieve the tenant from the obligation to pay rent, nor does it restrict the landlord's ability to recover rent that is due. Property owners who depend on rent income to pay the mortgage for the same property will see some relief, but not the same relief as the tenant themselves. Once any sort of moratorium is lifted, it will be very difficult to recoup the months of rent payments, which will result in more evictions. We caution local authorities from passing sweeping, knee-jerk measures to halt all evictions, but instead to consider thoughtfully more precise actions that truly protect the residents of Kern. Therefore, if your board is considering an ordinance, we strongly recommend you include 1, a definition of who will be eligible for eviction relief. For example, the following shall be deemed as adequate proof to qualify for relief under this urgency ordinance when presented with evidence of substantial loss of income. Let me bring this up a little bit. There. Whoops. Okay. A, letters from employers citing coronavirus as a reason for reduced work hours. B, letters from clients or customers citing coronavirus as a reason for reducing or canceling purchase orders, requests for services for hire, or other profit-generating contracts. Letters from schools citing coronavirus as a reason to keep students at home, thus creating a need for childcare. And D, letters from a doctor recommending rest at home for school-aged children or seniors due to coronavirus. Number 2, a sunset provision on the moratorium, 90-day eviction moratorium or until the governor lifts the stay-in-home order. On behalf of our association's leadership and members, we urge you not to adopt a local ordinance and instead refer to the federal and state measures already in place for our county's most vulnerable population. If we can be of any assistance on this matter, please do not hesitate to contact our offices. We are all in this together. Thank you for your consideration of these very important concerns regarding this matter. Sincerely, Kim Huckabee, CEO, Bakersfield Association of Realtors, Nick Ortiz, CEO, Greater Bakersfield Chamber of Commerce, Michael Turnipseed, Executive Director, Kern County Taxpayers Association, Jay Tamsey, CEO, Kern County Hispanic Chamber of Commerce. That's letter number 1. Hold on. Letter number 2 is from Adianka Glover with Leadership Council for Justice and Accountability. I will read her letter. Her letter also contains 4 attachments that board members and appropriate staff have already received. Good morning. I request that the following comments be read aloud into the record. The county's public meeting protocol as it relates to COVID-19 is wholly insufficient. The county needs to dedicate time and resources to implement telephonic or video chat capabilities for the board meetings for both supervisors and the public during the pandemic. The public should be able to receive the same information that the county does to inform their decisions in live time. Residents should not have to limit their public comments to email and voicemails at 4 p.m. the day prior to the meetings. Effectively coupled with the closure of the board chambers to the public, there is no method provided for the public to engage in real time. We have submitted a letter on March 18th and March 26th on this issue and eviction moratoriums. Both letters are attached. Despite the governor calling his March 27th order an eviction moratorium, it is not. The governor's directive leaves various communities unprotected by his executive order. Nothing within his order prohibits landlords from starting the eviction process. We ask the county to adopt an emergency ordinance regarding an eviction moratorium that protects Kern residents from being evicted. We would like an update on how the county plans to proceed on our request. We are also attaching Leadership Council's response to the governor's March 27th order that identifies the various inadequacies. We urge you to take immediate action. Yinka.
Thank you, Kathy.
Okay.
Can I make a comment about that last
Sure.
public statement? Can I refer that to you, Mr. Alsop, and our clerk as well? I think the issue is just, as I understand it, for the public to be able to comment in real time during our meetings. Right now, the way we have this set up, there is no way for them to do that, correct?
Can I make a comment?
I just want to refer to you,
Chairman?
if there's a way we can entertain that, I'd like to hear what that is.
So I would like to add some comments on it, thank you, and it should have clarified earlier. But the staff, Kathy's staff in particular, our clerk, spent an extended period of time reviewing board sessions from around the state of California, those that have the same legal requirements as we do as political subdivisions of the state of California, to abide by the governor's orders and by legislation, good, bad, or otherwise. All of these counties are trying to figure out how to deal with their public in the same way that we are. So often we look to other counties for best practices and opportunities and better technology that for whatever reason happens to land in one county over another. And I'm very grateful that our staff extensively watched board sessions all around the state of California. They reported back to us and to our clerk that all of them were disastrous. They were premature in their great ideals to include the public, which is what we always need to be striving for. But clearly at this stage, and I'm hopeful that by the next time we're here, this will not be an issue. However, at this time, the technology not only is not vetted, David, Supervisor Couch, but it is proven to be very problematic for the actual practical business of what we need to do as a county, in particular given our limited time period that we have to act. So as uncomfortable as it is at this stage, I am thoroughly convinced that our staff exhausted the resources that are available to us at this time, considered them and made a reasonable determination that at this time it did not make sense to attempt to employ that at this stage of the process when we have so much important information to provide to the public, of which we know we can receive input from via email, text message, and otherwise. It is not a perfect system. It is not a perfect world. Certainly, we're perfecting the process as best as we can. So, Supervisor, thank you for that concern. Supervisor, excuse me, Ryan Alsop. Did you want to add something to that? Got it. Got it. Did I cover it, Mr. CAO?
I thought you covered it. I would ask the public to have some patience with us. What we're doing is within the guidelines that the executive order of the governor. We're taking all measures to collect public comment, but again, a little bit of patience. We need to dial this in a way where it is functional with, it's practical with, and works with this setting and what we need to do, avoiding technical problems and other things. So we'll work on it.
Thank you, Mr. CAO. Supervisor Maggard.
Thank you. I just wanted to assure the public of one more aspect of this. I've pushed our staff about what social media opportunities are there to be able to put our meetings out there. But if we put it on Zoom, we can't protect the public from some crackpot getting in the stream of the Zoom view and disrupting and making it difficult for everyone that else is on that feed. If we put it on Facebook, you know the weird people that are on Facebook that say all kinds of harsh things. Who knows what people will be exposed to? So we are looking at all those alternatives, but I guess I just lost the Facebook constituency, didn't I, in my next election campaign, but whatever.
I don't know they're voting too much,
Yeah,
Mike, so,
probably not, yeah. Okay, enough said, thank you.
Thank you, Supervisor Magrid. Supervisor Couch, did you want to add something? Okay, great.
Okay, thank you, Madam Chair. I appreciate that information. And yes, we are trying to put our best foot forward for the public at this time. Item number 3, letter number 3, under public comment. This letter was received from Adam Cohen. Chairwoman Perez and members of the board, thank you for your continued hard work and support guiding our community through incredibly difficult times. I would like to take this time to raise awareness about another important issue impacting our community: sexual assault, domestic violence, stalking, and human trafficking. Every day, these horrific crimes impact our community. The state of California has established Safe at Home, an address confidentiality program administered by the California Secretary of State's office. The program, which provides a free post office box and mail forwarding service, is designed to help victims and survivors of domestic violence, stalking, or sexual assault to start new lives in peace and to provide added protections to their overall safety plans. The job of maintaining and recording grant deeds is a county function. Unfortunately, the city of Bakersfield, without any experience in recording law or regulatory function in the recording process, uploaded the city's grant deeds to its website for public viewing. In doing so, the city of Bakersfield exposed the residential addresses of many survivors of sexual assault, domestic violence, stalking, and human trafficking. We depend on our confidential address as a core component of our safety plans. Why brief the Board of Supervisors? The city of Bakersfield most likely obtained all of the city's grant deeds from the county recorder, not knowing that the city would violate our privacy and undermine our safety plans. Given these facts, we are respectfully requesting that the Board of Supervisors direct the County Administrative Office and County Council to develop a required data use agreement before Kern County public agencies are permitted to receive a data dump of grant deeds. As part of this data agreement, public agencies requesting grant deeds should have to comply with the following. 1, receive a briefing on the Safe at Home statute. 2, agree not to place grant deeds on publicly searchable websites. 3, demonstrate data security, such as how the grant deeds will be transmitted and stored consistent with public and private sector security standards. And 4, establish procedures to protect privacy. Our entire county has a fiduciary responsibility to protect survivors of violent crime. Please help us prevent this data breach from occurring again. Thank you to the board and county council for their great care and concern to uphold the Safe at Home statute. Now we will go to voicemail received. This first voicemail is from a caller who did not include their name, but it's related to property tax payment.
Wanting to know about property taxes. Are they going to defer it for a later month? That is just my concern. Thank you.
Not yet. Oh, yes, item 57. Voice message, the last voice message is from James and Emily Harvey. Since speakers are not asked to provide their address or phone number, Kern County Television staff were directed to delete the phone number included in the voice message. So I just wanted to disclose that before I play the voice message.
Yes, we are residents of Bakersfield. We own our own home. It's James and Emily Harvey. And we're calling just to let you know that we would like the coronavirus homeless patients to be put like toward Wheat Patch, which is out in the country, away from the general population of Bakersfield. We don't want it close to town. We feel that it would be safer for everyone if the patients that have the coronaviruses, the homeless people, or whoever else gets sick, to be placed like outside of Bakersfield, the city of Bakersfield, toward the country. And we thought maybe Wheat Patch, which is like 10 miles away. And we would like these corona patients to be placed in Wheat Patch, away from the general population of Bakersfield. Otherwise, it will spread quickly here in Bakersfield, and we don't want that. We want to try to keep everybody safe as can be, all adults, children, babies, everyone. And it's better for that it's better for the coronavirus patients to be placed away from Bakersfield. Thank you.
Madam Chair, that completes all public comment received.
Well, I see you saved the best for last. Thank you. Supervisor Couch, I don't know how you feel about concentrating all the COVID patients in your district, but certainly there's some concern out there, right, about how we're
I didn't think
directing
Weed
people.
Patch was going to come up today, but unfortunately it came up in that regard.
There it is. Okay, anything else on public comment?
No, ma'am.
Thank you. I'm sorry, Supervisor Maggard.
Thank you. When a caller makes a phone call to the county, and people say all kinds of things when they leave messages for us, and they kind of get riled up, and some of them get very emotional when they leave messages at our various offices. Do we have the individual caller's permission to broadcast to the entire world what they said in a phone conversation?
I assume so.
Supervisor Maggard, through the chair. Yes, in accordance with the directions that have been provided to counties in complying with the Brown Act, and then the information that was posted along with the agenda, identifying how people who wanted to leave a public comment may do so with a dedicated phone line just for that purpose. We are within our
So
bounds.
this call, for example, that we just received, the call was made specifically to make public comment at our public meeting? So, yes. Okay.
Yes, sir, that is correct.
Okay, so the guy that called my office and was ranting about Hillcrest Shopping Center, that's a different thing, and that guy's voicemail is not going to be put on for the whole world to hear how he talked.
That is correct.
Okay, thank you.
Great clarification. Thank you, Supervisor Maggard. We're going to move along to item number 12, which is board member announcements or reports. I'm going to start by making a referral to the clerk of the board in regards to the Board of Supervisors meeting schedule. We should consider canceling April 28 and May 12 meetings. If the clerk of the board could bring an item back on April 21st to amend the Board of Supervisors meeting schedule. I understand we're going to be dark the next 2 weeks, which was established before Corona, and we do not want to go longer than 2 weeks without coming back together and commiserating. And so I understand that on the 21st, we'll have an opportunity to reevaluate this schedule, but for now, the floor is yours, Madam Clerk.
Madam Chair, the idea was, in looking at the board's calendar, that we could possibly streamline some meetings. So the two meetings identified, April 28th and May 12th, would just, by deleting those meetings, adjusting your schedule to delete those meetings, departments knowing in advance what the schedule is, they will be able to place all their items on either the April 21st meeting, the May 5th meeting, the May 19th meeting, and that will take us through the month of May, and hopefully we'll be in better shape by June.
Indeed, we will be. No doubt in my mind. Thank you. So this referral, do I need a vote?
You can if you'd like, or you can just direct me to place an item on the next agenda to amend your schedule, your board meeting schedule.
I think that's adequate.
Thank you.
Thank you, Madam Clerk. We're going to move on to item number 23. I'm so sorry. Supervisor Scrivener and then Supervisor Maggard. My mistake.
Thank you, Madam Chair. I'm sure a lot of the members of the board and the community have seen recently that the Bureau of Prisons has said that they're going to close the Taft Correctional Institution on April 30th. They're starting to move prisoners out now, and their plan is to continue to move them out I think that most of us were blindsided by this decision, and obviously there's huge impacts to the community of Taft and Kern County because of the loss of jobs that this is going to cause. But I think that right now, in light of the pandemic that we've all been discussing today, and everyone has been discussing, the move to move prisoners out of the Taft institution and disperse them across the country flies in the face of the governor's stay-at-home order and everything that we're hearing, every directive that we're hearing to try to keep people safe and try to keep this pandemic contained as much as we can. I'm in receipt of some emails that I passed along to county staff that are actually from family of inmates that are very concerned with them being moved out. And I think that so it's not just the folks in our community that work there. It's the families of people that are being moved out and sent to other areas. And so I'd like to make a referral to staff to draft a letter. I've already sent some information over to the county administrative's office. I know that that Thomas Brown has been working on that he's working on a draft probably as we speak. And so this board has already drafted a letter that objected to the first announcement that they were going to be closing this facility. And here we are again in the face of this pandemic, and they're planning on sending thousands of inmates out and then across the country. And so I'd like to make a motion that we direct staff to draft this letter, and I would ask the chair to sign that letter. And I'd like it to go to the Attorney General, the Bureau of Prisons, and then obviously copy our congressional delegation. Thank you. That's a motion.
Second.
Supervisor Scrivener, thank you. We have a motion and a second. Please cast your votes.
The motion is approved. All ayes.
Supervisor Maggard.
Thank you. First, I'd like to remember and honor today Bob Otto. Bob Otto passed away this week at the age of 98. He was a World War II and Korea bomber pilot, and most of us know him not from just his war record, but he played taps on his bugle at hundreds and hundreds and hundreds of funerals for veterans after they passed away. He was a remarkable fellow, and because of the times we're in, we're not going to be able to honor him in the traditional way, at least at this point. But I wanted to make sure he got mentioned this morning because he deserves our respect and our recollection. So thank you for indulging me to do that. I want to take a pause for a moment also just to talk for a moment. I'm putting on my businessman hat now. The CARES Act was passed by the House finally after the Senate passed it last week. I want to urge the public to make sure that they are doing what is necessary to receive the benefits included in that act. If you have not filed your tax return, and you can file your tax return, I'm urging the public to file it. Make sure you include in your tax return your bank account. You don't have to tell them that you're going to make your payment with your bank auto withdraw from your account, but include your bank account on your tax return so you get that stimulus check faster. That will help you do that. They only have that information if you file your return. That's the first part of it. The second part of it is if you're an employer, there is a very, very generous opportunity for employers to be able to keep their doors open and continue to pay their employees with this loan opportunity that's there. So if you're an employer, a business, and you're struggling, I urge you to call your bank, get in line right now on how you can do this, because once we pull the brakes off and start to crank back up our economy, every business that has survived and can open their doors again to make sure those employees go back to work, not only does it help you sustain the employee's payroll during the time that you're closed, but it will get you going again. I'm urging every business in our community to make sure they're talking to their advisors about that. So just seek the right counsel and go move as quickly as possible, because the longer you wait, I think the more endangered your business and the jobs of the people we represent will be. Thank you for your indulgence.
That is incredibly helpful, Supervisor. Are we to assume that people who have filed their taxes are okay?
For those that have already filed their tax return, they'll use 2019 to determine if you qualify for the $1,200 per person, $500 per child stimulus package that's there. they'll use a 19 return if that's already been filed. If you haven't filed your 19 return, they'll use your 18 return. Well, the guidelines on who qualifies might be interpreted differently if it's 18 versus 19, so you might want to file that return quicker.
I see.
If you filed your return and did not in the past include your bank account number and routing number on your return, then they will mail you a check. It will take weeks for it to get here. If you file your return and include those account numbers, it will enable them to send that payment, the stimulus payment, directly into your account, and you'll get it a lot quicker.
Extremely helpful, Supervisor. Maybe we should put something out. Ryan, it would be, I think, really helpful to the public if the county were to include something on our website that, Supervisor Maggard is a CPA, so he's an actual expert in that field, and I think people are so confused about this issue. If we could put something out, just general, that give people some general guidance, that was extremely succinct and helpful. I really think the public would appreciate that. If we could consider that, I'd certainly appreciate it. Thank you so very much. Okay, any other board member announcements or reports? I see no one else checked in. Okay, we're going to move along then to item number 25, which is a report on local emergency, COVID-19. I appreciate the patience of our ingenious, overworked staff right now who are here. Certainly appreciate you and admire your devotion to Kern County. Ryan Alsop, the floor is yours. And thank you, Ryan, sincerely.
Yeah, Madam Chairwoman, members of the board, thank you. This is another COVID report, if you haven't had enough already today. I'm going to move through this quickly. March 16th, our county declared a countywide local emergency due to COVID-19 and implemented previously established continuity of operations planning, moving to essential staffing only across all county departments through April 14th. Our EOC was activated on March 16th, and it remains active today, supporting our public health director and his staff, who are incident command during this emergency. The EOC is holding daily calls with public health, city managers throughout the county, PIOs, school districts, and others all over the county to ensure continuity of operations and communications. Our EOC is in regular contact with the state OES, Office of Emergency Services. County residents and businesses with requests for information or direction related to COVID they can continue to contact Kern County Public Health directly, both online and by phone. They have a direct number and they have a call center with a human being that will pick up the phone. Residents throughout the county who are unable to connect with the internet, I know we have many, from home can access free Wi-Fi at all county library branches, as well as most county buildings. They are hotspots for your communities. You can, even though the building may not be open, you can access that signal from the parking lot, and it's free to you. Homeless services are being coordinated through the Bakersfield Kern Regional Homeless Collaborative. Our Executive Director, Anna Lavin, with regard to services needed for that population, shelter, food, and other assistance. We are coordinating financial assistance coming from the state through the collaborative and working with the city of Bakersfield and other cities. Kern County Fairgrounds is identified as the alternative care site, as Mr. Constantine mentioned. It's also known as ACS, and we continue to work closely with Mike Alcott and his team on that planning. Our hope is we don't have to move into the fairgrounds, but we will make sure that we are prepared to do so in the event that it is required. As part of the ACS at the fairgrounds, we'll be housing 15 trailers that will be used. These are trailers coming from the state. These are trailers being given to Kern County. They will be used to house those who've tested positive or are needing to be isolated, but are without a home. Kern Medical has stepped forward and they will manage that entire effort for us. They will provide the wraparound services, and we will be working with them directly, again, along with our friends from the city of Bakersfield to ensure that is all working. Upon implementation of the essential staffing only plan on March 16th, our county departments were instructed to send all non-essential staff home and to make all arrangements necessary in giving all staff deemed essential the ability to work from home. Departments have been instructed for all essential staff who are physically reporting to work to limit the number of those staff, implement all measures necessary to have those staff practice social distancing, practice regular hand washing and cleaning protocols recommended by our public health officials, and to limit to the greatest extent possible interface with the public. Virtually all county buildings have been closed to the public with limited exception, again, only for essential public services. County departments who are maintaining the county's essential functions are coordinating with our public health director on equipment that they may need to both protect their staff as well as the public. And obviously, we have a range of businesses here as a county government, along with functions provided by those deemed essential staff. Your department heads, as you know, are here today. I thank them for being here. And I'm, following these comments, going to ask that each of them come forward and provide your board with a brief overview of their continuity of operations planning during this local emergency declaration. Today, out of an abundance of caution and due to the progressive spread of COVID-19, both nationwide and in our community, and in line with the recommendations of the federal, state, and our own local health, public health officials under the authority granted to me by your board, I'm extending our local emergency along with our essential staffing practice through May 1st. This extension is also in line and is supportive of the recent announcement by the superintendent of schools that schools will remain closed until May 1st. I want to personally thank our county employees, all of whom are working through extraordinary times, for their continued support, whether in times like this or just ordinarily. Our county employees do amazing work every day, and I know your board understands that and appreciates that. I want to thank specifically those county employees who have been called to action under these difficult circumstances to continue to provide essential services to our residents. Our sheriff's deputies, our firefighters, probation officers, coroner's office, employees with the district attorney's office, public defender, child protective services and human services personnel, child support services, behavioral health and recovery services employees, animal services employees, airport personnel, public works and planning personnel, our employees who continue to see to the welfare of our community's elderly and veterans, those continuing to provide oversight at ag and measures, an important function of the county, and our elections personnel, to name a few. There are others. Special thank you to our public health employees and those employees managing our EOC, the county's Emergency Operations Center. Fire and sheriff personnel are there. Our fire chief is in command of the EOC and members of his staff. There are members of my staff who are there on a daily basis. And thank you for your continued commitment to our residents and to your work ethic. And lastly, in light of the efforts being made by our first responders and other essential staff during this difficult time and to address some of the challenges they face in having to report to work and also to take care of their family, my office is working on a plan for those employees that will assist them in paying for child care. Additionally, for those who are working from home, like our child protective services workers, we will help them with a technology stipend from home. It is also my office's intention to bring before your board a plan to provide our first responders and essential staff during this unprecedented emergency with some additional paid leave where they are able to use it when this is all over. I intend to bring this item, which will be retroactive to our local emergency declaration on March 16th and sustained through the end of our essential staffing planning, for your board's consideration on April 21st. In the coming days, our HR staff will continue to work on this plan, and we will be talking with our labor partners, and I'm going to thank them now in advance for their support. Unless there are questions of me, I'm going to ask our department heads to come forward, if they wouldn't mind, to briefly discuss some of their operations. I would like to start, if you don't mind, with Ms. Bedard.
Thank you, Ryan. As we hear from different department heads today, we will pause so that we can take questions from the dais for each and every department. Doesn't mean we have to, but we will pause for that opportunity. Nice to see you.
Good morning. Mary Bedard, Auditor Controller. In our office, all but 2 employees have been deemed essential. Most of them are able to work remotely. Payroll, accounts payable, and FMS staff are processing the county's payroll and payments to vendors. The rest of the Auditor Controller staff are mostly working on projects, including continuing work on the implementation of the new payroll and general ledger system, which can be done remotely. County Clerk is performing services that can be done by mail and email. Like other California counties, we are not issuing marriage licenses, which must be done in person. Most election staff are now working from home since the bulk of the ballot processing has been completed. We are doing the final reconciliations and checks now and expect to run the final update and certify the March election to the state tomorrow or Thursday. We are accepting petition submittals by appointment, and the rest of the election staff are working on planning and doing preliminary work for the November election. That concludes my report.
Thank you, Ms. Bedard. So the official certification will occur no later than Thursday, it sounds like.
That's the plan, yes.
Okay, very good. Well, thank you. A marathon 2020 election. I think you and your staff were remarkable. I appreciate your consummate professionalism and your grasp of the issues. And I mean, I know we need big upgrades to your department, and we need, new, fresh human capital, right, to develop over the years. I mean, that's a huge priority, and you continue to bring that to our attention. But despite all of those vulnerabilities, I think you performed very well. So thank you.
Thank you.
I appreciate that, and I think my colleagues may have some answers of you. But if they don't, we may call you back up again. Supervisor Maggard.
Thank you. Thank you for the work. Thank you for your staff's work getting us through the last election. As we look forward to November, there's discussion of different ways to conduct the election. And can you report back to us at a future meeting if there are critical dates we need to hit, and if it's vote by mail only? I don't know what the answer will be, what the suggestions will be. But as we ramp up for that, can you just keep us up to speed as to how that is the direction that's tacking, so that we'll know what to anticipate and we can keep the public informed?
Yes, Supervisor Maggard, through the chair. In fact, that's one of the things that the staff is working on now. We're getting, it hasn't been finalized, but just planning different scenarios for what, if we had to go to all vote by mail in November, what it would be. And yes, we can bring the information back.
Very good. Thank you very much.
Thank you, Supervisor Maggard. Colleagues? Ms. Bedard, thank you. Please stay close.
Thank you, Madam Chair. We're going to have Dina Murphy from our Department of Human Services next.
Good morning, Madam Chairman, members of the board. Department of Human Services currently has a total staffing allocation of 1,679 employees. Of those, 33% are not working, 26% are working from home, and 41% are on site. Of the 41% on site, 73% are eligibility staff who are needed to provide basic essentials such as food, shelter, homeless assistance, and Medi-Cal. The remaining 27% of the staff includes facility mail service, IT support, minimal amounts of clerical support and management, as well as our shelter coverage. We've been very successful in diverting our customers to the use of available telephone and online services. As an example, in January, we had 82,000 individuals walk through the lobbies of our human service offices in the district and our main building, 82,000. We were down last week to 38 individuals with in-lobby contact. And let me qualify that. We have closed our lobby doors. We have a liaison who meets the homeless, which is why we're remaining manned in those offices in the lobby area, because they have no form of contact if we're not there to meet them at an office. And we have a mechanism where they're handed a phone, kept at a distance, and our folks are behind glass. 100% of our social service workers and welfare to work have been sent home with a suspension of welfare to work services. For our essential staff and CPS, 100% of our child welfare services staff is working telecommuting, which I understand from a call that took place last week. We are the only county in the region doing that. Other child welfare service professionals are in their offices because they didn't know or hadn't had a plan to have laptops for all their social workers and a plan for emergency calls and the responses. So our child welfare services are continuing to link via Skype, et cetera, having their home visits, their family teaming meetings, meeting all requirements, and then our actual investigations are business as usual with the appropriate medical masks and medical grade gloves, protective equipment, if you will. There are 2 social workers who are on site at Jameson for the intakes of children as that process continues. And I thought it important to note that on average, since the COVID began, we have an average 88% increase in emergency services. We have a 2,300 emergency service increase since 3/14. That's a 117% increase. We have a 570 immediate need requests for CalWorks, which is a 59% increase. That basically is what I wanted to share with you, but I'm available to you for questions.
Thank you very much for your succinct and very precise presentation. Your department is one of the most complex given its size and the vulnerability of your population. So, Dina, thank you.
You're welcome.
Thank you very much. Supervisor Gleason.
Thank you, Madam Chair. So what does all that mean? I mean, those are interesting statistics, but how is that impacting us in the county? What do we need to do to accommodate you or accommodate things that you're doing or not doing?
I'm really proud of Kern County and us being ahead of the wave. For instance, when I just shared with you about the laptop computers and social workers, that's not being done in the region. Kern County social workers are at home and continuing their work with families. We don't have that same connectivity yet for our eligibility technicians, but what you would experience in this community, the unintended consequence of that not continuing to provide the food, the sheltering piece, the basic necessities, as we call it, would be a loss of an underpinning of our safety net for other families who then could in turn become homeless or without food benefits and things. So we have staff at Human Services doing that via phone and electronically. I think one of the things we'll see out of the future with this is more being done electronically. I think that will end up being a long-term benefit, but it took a little working the bugs out. We certainly have taken an increase in our phone line contact and shifted our resources to the degree that we can. And we're currently, as of this morning, I think we found an opportunity for 100 connections for eligibility to work from home as well. So that may take up to 3 weeks to get finalized, but I think we're on the cutting edge of things and feel very supported from the board, from the CO's office, and HR for all the ongoing, shifts and sensitivity to, staying healthy and well. You're giving us everything you can at this point.
Right. I'm trying to figure out this remarkable story you're telling me, and I'm trying to take all that data and turning it into knowledge in my brain so that I understand how to understand what you're saying, your issues are, and what your future looks like, and what I can do to help that. And I don't know how I can do that yet, but I'm looking for it. Thank you. I'm done.
Thank you very much. Supervisor Gleason, seeing no one else plugged in at this time, we'll get back to you, Dina. Thank you.
Madam Chair, the District Attorney's Office.
Who'll be presenting after our DA?
I'm going to ask the Sheriff's Office to.
Thank you very much. Good morning, Ms. Simmer.
Good morning, Madam Chairperson, members of the board. The Kern County District Attorney's Office is working very, very hard to protect the public. At this time, out of our 250 employees, we have about 20% of those, give or take, coming to work in the office on a daily basis. 80% are working at home to the extent that they can. But we are working and we are accepting cases from every law enforcement agency in Kern County. And so we are very, very busy. You may say, how can you handle the flow of all these cases with 20% of your employees? And it is in part because the Supreme Court Justice, the California Supreme Court, has issued orders that have delayed or given us more time within which to conduct cases. The majority of the flow of our cases are after a felony arrest or arraignment, preliminary hearing, and then trial. Trials have been extended out for a period of time. However, we are still going to court on preliminary hearings and arraignments. As a matter of fact, I was there yesterday. I also wanted to let you know that our investigators are working very hard in investigating referrals of price gouging. We have been looking at those. Different departments throughout the county, law enforcement departments have been looking at them, but we have been looking at the lion's share. We have looked at over 60 of those, and while we're still working on them, I can report that the majority of Kern County merchants are following the law. There have been a lot of Facebook posts and things like that, exaggerations, sometimes 2 quarts of milk rather than 1, and prices that weren't really quite accurately reported. But we are looking at these, and merchants really are, at least in the big chains, following the law. My immediate priority, however, is that we are able to install technology in courts for remote hearings. It is a big problem. The Justice of our Supreme Court has asked all counties in California, and we as elected district attorneys have nearly daily contact about what we are doing in court, because we are still going to court and putting on hearings, evidentiary hearings, calling witnesses, exposing the public, civilians, witnesses, law enforcement, to the potential of the spread of the virus. One of the things that we've been able to do as the district attorney's office is to provide laptops to our employees so they can work from home. And we have also set up remote access in our negotiations with defense attorneys in court. So our attorney representatives can have remote negotiations. However, we haven't been able to do any type of remote hearings, and preliminary hearings are the big ones, not just in Bakersfield, but in all our areas of Mojave, Delano, Shafter, and juvenile court. So I guess if I have an ask today, supervisors, and that is that our county IT department can partner with the court's IT department, because this is bigger than the DA's office. Mm-hmm. We've been able to do some of it ourselves. My assistant DA actually is very technologically inclined and set up a lot of this himself, but we need the help of county IT to partner. So this is not technology that is beyond us. We can do this. We don't have any more laptops, and we don't have the ability to go over and partner with the court to set up some of these hearings to protect the public. So we have a meeting tomorrow. I hope the county IT will come with us to the meeting with the court IT. The presiding judge is going to be hearing that meeting. Our public defender is coming. So that, I will tell you, is our immediate plan. But my biggest problem is really keeping employees at home. We have an amazing staff, these lawyers, investigators, these people want to come to work and work. And I have to tell them to stay at home. But they are finally doing that, and we're doing well under the circumstances. So that's my presentation. I am concerned about these hearings, and if something happens, God forbid, this gets into the jail, and then what will happen with the inmates and so forth, and then the public coming into court. And it's hard to social distance in court.
Yeah. No doubt. Ms. Zimmer, thank you. You said you were doing criminal arraignments. Are you doing both misdemeanor and felony criminal arraignments?
Yes.
That seems to me the easiest place to do video.
The video arraignments are being done through the jail. If a person is in custody, there will be video arraignments that come from the jail. And the Sheriff's Department recently implemented that. I'm doing a murder case. I went over for the arraignment yesterday. While I was in court, the inmate was at the jail, and we arraigned him via video.
I see. So in custodies are being arraigned via video, but you're still having the public in for regular arraignments.
That's correct. They are delayed. They are delayed. The arraignments are delayed, and they're given tickets for a later time. So if someone is an out-of-court arraignment or an out-of-custody arraignment, that arraignment can be at some time in the future.
So is this happening daily?
Yes.
So daily you have the public coming in for both misdemeanor and felony arraignments?
Yes.
Yikes.
In various courts throughout Kern County, although 2 courts are closed, Ridgecrest and Lamont.
Okay. Wow. That's a lot of public exposure.
It is.
As you know. And what other sort of constitutional changes have been made to give you some leeway within, what are otherwise the strictest boundaries on timeline?
Well, there is a requirement that a person who is arrested and in custody is arraigned within 48 hours. Right. The Supreme Court has expanded that period of time to where it's a later time. A person doesn't have to be arraigned. But one of the things that we are trying to do to alleviate jail overcrowding is we are looking at those cases within 48 hours, and if we reject a case and intend to release the inmate, we will let the jail know as soon as possible.
So that's what a lot of your attorneys are doing at home, essentially.
Yes.
Is maneuvering through those,
yes,
that background info, which just takes so much time.
It does. It does. One homicide can take a full day to review.
So you said you're doing 2 things, arraignments, of which we know now are both misdemeanor and felony, but only in person for the public, are in custody arraignments, which is the vast majority, from my memory, are being done through video. Okay, that's very helpful. You said, secondly, you're doing preliminary reports. Was that what the term you used?
Preliminary hearings.
Preliminary hearings, and that's what you just gave us you gave us some information about, correct?
Well, as you recollect, Madam Chairperson, being an attorney yourself, that the day before the preliminary hearing is the pre-preliminary hearing.
Right.
And those are done in a small jury room. They originally were where all attorneys get together and do negotiations. We're spreading those out, and that's what we do remotely now. However, when it comes to the time, if the prelim doesn't settle and we have to put on a hearing, that is still in court, and that is our immediate need for the help of technology.
Well, they're so time-consuming and really intense, especially your felony preliminary hearings.
That's correct on our violent offenses. Our gang murders, our child abuse cases, some of these do take quite a long time to put on.
Are you seeing any kind of decrease in new cases with more people staying home?
Well, I expected that question today, and I wanted to have an answer for you because I feel that we are seeing more domestic violence cases and more child abuse cases. Right. But that could be something that we're just hypersensitive about. We've been trying to put out to the public hotlines in different ways that people, if they're feeling stressed, if families are in crisis, that they can call. But we are seeing some very violent cases. We're still seeing gang shootings. But the jail is overcrowded, and they're having to reserve space for the most violent.
Very helpful. Ms. Zimmer, thank you. Colleagues, any questions at this time? Supervisor Couch?
Do we need a motion to have our IT department go do exactly what she's requesting? Okay.
We're all in on that.
Thank you.
Supervisor Maggard? No? Thank you, Ms. Zimmer. We might come back to you. Thank you so much. We have a representative from the Sheriff's Department. So nice to see you, and good morning.
Good morning, Madam Chair, Supervisors. Under Sheriff Doug Yock, as you can all assume, all sworn staff within the Kern County Sheriff's Office are mandated workers. They're out there every day. They're in the facilities. We have changed a lot of the things that we are doing on patrol and in the facilities. One of which we switched our patrol shifts to 12-hour shifts. The biggest advantage to that is it gives more time on patrol, but it also eliminates 1 day from each one of those deputies having to come in to get the normal 80 hours that they would work. So that limits their exposure and the exposure to the public. Patrol deputies are still responding to every call like we always have. The only thing that we've changed is that in the event that a victim or a witness can be contacted by phone instead of in person to help mitigate that, we're doing that. We're still out there having to go and contact the suspects in person and do everything we've always done. If there is a call for service out in the public, the deputy may call and get the information on the phone, but if it's a suspicious person or a theft or somebody of that nature, the deputies are still going to respond to the area and attempt to locate that person. So we have not stopped trying to enforce all of the enforcement that we have out on patrol. In the jails, we've taken extreme measures to try and keep COVID-19 out of the jails, working with Kern medical staff. Every employee, every sworn staff, and every inmate prior to entering the jail goes through a screening process where their temperature's taken, they're asked certain questions, they're placed in a mask before they're even allowed in the facility until they pass the screening. We're doing everything we can to keep this out of the facilities because once it gets in there, it's going to be an extreme problem. We've dedicated space that's been cleaned so that if we do get it into the jail, that we're going to be able to isolate it and have a place where each one of those inmates will be moved to try and keep the rest of the population free from it. As far as our non-essential staff, they've been great working with us because we've sent the majority of them home that we can. However, the situation with us is fluid. We've taken some of our sheriff's aides that weren't working in the facilities that were in non-essential places. We've moved them out to the facilities to ensure that we have extra staff out there to help. And the other non-essential staff, some of them are working from home. Some of them are coming in a few days a week to get the things that need to be done. But we're doing everything we can to mitigate the exposure within the facility too. And with that, I'd be happy to answer any other questions that you guys have.
Well, thank you for your succinct report and for your ascension. Congratulations.
Oh, thank you.
Is it yacht?
Yacht.
Yuck.
Yes.
Okay. How do you spell it?
J-A-U-C-H. Nothing like it's pronounced.
This is not going to be fun. I'm just telling you right now. This is going to be work for me. Okay, thank you very
welcome.
much. I see that Supervisor Maggard has a question for you.
Thank you. I'll have the same question for Under Sheriff Yock as well as probation and as well as fire in a little bit. Are there any supplies, anything you need so that we can be certain that those that are, at the tip of the spear dealing with the general public in very unpredictable circumstances, do you have everything you need for them to be as safe as we can make them?
Supervisor Maggard through the chair. At this time we do. I have 3 staff that are designated daily. They're giving us a report on what our supplies are, the estimated time that the supplies will last during the current environment unless it gets into the jails. Right now, we estimate anywhere between 5 to 8 weeks worth of supplies on hand. We're working with our local, state, and federal partners every day to get more personal protective equipment in. We're doing everything that we can to monitor it. Every patrol deputy's been issued 2 of the N95 masks. That said, if they utilize one, their sergeants have extra supplies that they'll replenish it. But we work very closely with public health to ensure that we're following all of their guidelines and that we're not just wasting the supplies, because if this gets into the jail, those supplies are going to go away very rapidly. There are 2 items that we've reached out to county purchasing. We're waiting to see if Cal OES is going to reimburse for those. One of those is going to be a machine. It would actually be 3 machines that we could place, 1 in each facility and then 1 for our patrol vehicles and vans. That is a spray. It sprays the disinfectant into the vehicles and into the jail cells that will completely disinfect and kill the COVID-19 virus and any other viruses. It looks like those are going to be approved by Cal OES, and then we'll move forward with the purchasing on those. But those are the biggest items now, and the normal PPE.
Well, let us know if there's something that we need to do to help, provide a backstop of protection for you guys. And I'll just ask the fire department and probation to give us the reports when you guys come up. I should have asked the same question of Dina Murphy, and I'm not, it has not come to my mind how many different departments there are that aren't interacting with the public directly, but making sure that we have that so our employees stay safe is vital. So thank you, Under Sheriff Yock.
You're welcome. And one other thing that we are doing on patrol is, as much as possible, we're asking the reporting parties to step outside to talk to us so we can maintain that social distancing as well.
Very good. Thank you.
And lack of confined space, which
Correct.
is really smart. I really appreciate that. How are you on sanitation wipes? Your institution is problematic for the same way that the New York subway system is problematic, right? Stainless steel, you've got 3 days of this stuff with everybody touching it. So that is a serious problem. How do you feel about your sanitation wipes? Is there something we can do to implore the medical community to step in and help? And follow up to Supervisor Magritt's question. I've heard about sanitation wipes in your institution.
Correct. Madam Chair, right now, like I said, we have 5 to 7 weeks of supply. That said, that could be diminished very, very quickly if it got into the facilities. We have increased the amount of cleaning inside of the facilities that we're doing. Our suppliers, we've continually placed orders with all of our normal vendors. Some of our vendors are slowly starting to replenish. Some of the vendors cannot give us an estimated time. And a lot of our vendors that we get these supplies through also deal with the public. And I know the public's out there buying these supplies up as well. So we're doing everything we can. That's where these 3 machines that we want to buy that come with the solution, that would not be the wipes. That's literally a wand, kind of like it's not a high pressure steam cleaner, but it sends the mist out into the air, and that then within an hour dries and it kills everything. So that would help tremendously. The issue with those machines is they're $15,000 a machine. Cal OES looks like they're going to pay for that, but the bigger issue is a lot of the other counties have already purchased them, so now there's a little bit of a waiting list.
I see. Well, don't worry, Supervisor Magritt will pay for those machines. He's the money guy. Well, okay,
Perfect.
keep us posted. I mean, I know you know how to access us, but this is really important. It's important to us. If there's some way for us to intervene, all hands on deck for you. Your institution is obviously of utmost concern.
And we appreciate that. And like I said, we're on conference calls every day and trying to stay in line with best practices and what other counties and state and federal law enforcement agencies are doing. So,
good to have you as the undersheriff.
thank you.
Yuck.
Yuck.
I'll work on it.
Thank you.
Thank you so much. Good morning.
Good morning, Madam Chair, members of the board. T.R. Miracle, your Chief Probation Officer. With probation, there's a lot of things we do, but there's 3 main functions, and we are treating each of them a little bit differently. Those are court services, our community supervision, and then our juvenile in custody facilities. So our court services, we provide a lot of services to the court. For example, one time there's a sentencing report on a felony case or any juvenile case, we do those reports. As the district attorney talked earlier, with preliminary hearings, we do a write-up for the court to try to help that process along. So we've been able to continue all of our court services. And when this happened, there are still a lot of things that were scheduled. So as we go forward, because of what the Chief Justice has done in allowing some things to go forward, we're hoping that with our court services, we'll be able to send more people home and do things from home versus having to get that stuff in as the court process slows down a little bit because of this situation. But we've been able to maintain every court service that's been requested of us. With our community supervision, we're doing a lot of things from home as far as checking in with people, seeing how they're doing our case notes and case planning. We continue to have armed officers available for both juvenile and adults, and we're still responding if there's a high-risk situation in the community. So we are not doing maybe our normal practices of just going out just routinely, but we're available and keeping up on everybody. And if there's something that we need to go to in the community, we are there and ready to do that. Lastly, we have our juvenile in custody facilities. As you probably know, we run 3 juvenile facilities: Juvenile Hall, our Camp Owen up in Kernville, and our Kern Crossroad facility. So all 3 of those facilities have remained open. I just want to really thank my staff for everything they're doing, because they're right in the front line, and people don't stop committing crimes, and we still have people coming in. So we have to deal with that. So we're doing everything we can. We want everyone to know that if somebody needs to be detained, they're going to continue to be detained. If there's people that those lower level offenses, we're looking at those to see what makes the most sense from a public safety as well as a public health issue. You asked about what we need. We've tried as much as possible to order, in anticipation of this, and we keep ordering, for our supplies. PPEs are something definitely that, we've requested, and we've had some communication with public health, and we appreciate that relationship with them. But just as the undersheriff spoke about, it's very important to do everything we can to we haven't had any positives in custody, but that's a very big deal. Because of the setting, it's hard to have social distancing, when you're in that type of setting, and we continue to need to do services for these youth while they're with us. But we have greatly decreased visitation has been suspended, and we have a screening process before anybody comes in, including checking temperatures and asking questions to make sure that we can try to mitigate as much as possible.
That's fabulous. TR, have you gotten what you needed from public health?
We just recently asked, and we're working with them, so I'm confident we will.
Perfect.
But those are the things, just like you said, just in anticipation of how long this lasts. We have a lot of orders in for stuff, but and so we have supplies right now, but just as this goes forward, we just need to keep those being replenished. Thank you.
TR, you rock. Thanks, brother. Good morning, Chief. Nice to see you.
Good morning, Madam Chair and members of the board. The Kern County Fire Department is happy to report 47 fire stations are open and fully staffed. We've been successful in maintaining a 2-week supply of personal protective equipment for our firefighters, and we have increased our schedule and depth of sanitation to ensure we are doing everything possible to keep our workforce healthy and maintain our standard level of emergency services. We have designated a team of personnel as a COVID-19 task force and have been successful in providing response protocols, ensuring an adequate supply of PPE, and tracking our personnel who have been exposed to COVID-19. I am pleased to report we have not had any personnel test positive to COVID-19. Our dispatch center personnel are hard at work fielding 911 calls, including additional questions to determine if we may be exposed to COVID-19. We are taking extra measures to ensure their workspaces are sanitized because they are a critical link in our emergency response system. And I'd like to just take a quick second. Please join me in thanking of them for an extraordinary job they're doing during the week of April 12th through the 18th, because we won't be able to do a proclamation during the National Telecommunications Week. In addition to that, I know Supervisor Maggard has had questions about PPE, and I appreciate that. We appreciate that as a fire department. We have a 2-week supply. I would love to have a larger supply. I've put in a request to Public Health for a month's supply. We're working with our providers that normally provide this to us. We're hopeful that during the week of April 8th, we will get our next shipment of supplies. But in the meantime, we're taking extra steps to make sure that our PPE can last as long as possible. Such steps as having, if possible, having the patient come outside their home if we believe that it's COVID-19, as well as maybe only having one person exposed to the patient versus 3. So we are actively pursuing various methods to make those supplies last. All of our safety section personnel are actively working. Those that are physically capable of working at this time, our general employees, the far majority, are actively supporting our mission to keep our fire stations up and running. I'll take questions at this time.
Chief, thank you very much. Supervisor Maggard.
Thank you. Chief, these are extraordinary times, so we're going to consider extraordinary measures. Is it necessary for a fire truck and an ambulance to roll to every call? And should we consider whether or not we should change that protocol so as to not expose a fire crew and an ambulance crew to the same virus?
So as of this time, it is important that we respond together with the ambulance. Oftentimes we get there first. Sometimes it may be a COVID-related response. Sometimes it may be heart conditions, a variety of emergency responses. And so it's important that we adhere to that now. However, as time goes on, if the situation dictates, we will definitely look at what calls we go on right now and evaluate that situation. Oftentimes the ambulance company may just need help lifting a patient onto a gurney because there may be two people. CPR calls. It takes a few of us to adequately administer the appropriate care.
Yeah, I'm not suggesting one size fits all, one solution will fix everything, but having someone evaluate every call to discern, we may come to the point that that's necessary to evaluate who responds, and I don't know how
Yes,
you go
sir.
about doing that, but this kind of flows to MCAB a little bit, I suppose, but I just hope you are thinking ahead about that, and could you give us an assessment at some point if that's necessary?
Yes, sir.
Thank you very much, Chief, and thank all the staff for what they're doing.
Thank you, Supervisor, for your consistent emphasis on PPE. Can you tell me which PPE you need? In a perfect world, of which lots of people need, so this is not a criticism of anybody. What is the number and what specific item are we talking about?
So with the personal protective equipment that we would wear to a suspected COVID-19, actually to all of our medical emergencies now, a gown, a set of goggles, latex gloves, are the standard equipment that we would wear for this particular situation.
Masks, Chief? Masks?
Yes, and masks. And, we have a variety, right now, certain size of gloves were a little short.
Which
the
size?
Gowns were
Which
short,
size?
extra large. We should receive a order soon for those. Yes.
So what number amount are we talking about? The public is watching, people want to know how they can help, and these are real practical ways for them to help?
Yes,
to alleviate some of this
I
need?
think right now, though, we are good. We're good. I feel confident today that we're going to get medical supplies either through the state, through public health, through the state, even though, as Mr. Constantine alluded to, it hasn't been a perfect system. There's a national stockpile, as well as our local providers, Boundtree and Ellen Curtis, have assured us that they're going to get us supplies. I think today, right now, I would rely on them. However, if we get into a pinch, I'll be reaching out.
Excellent. Thank you, Chief, very much. Supervisor Maggard, did you have a follow-up? Thank you very much, Chief.
Thank you.
Madam Chairwoman, we're going to have the public defender go next, but I just wanted to invite animal services up. I'm kind of we're not picking favorites here, everybody. This is a kind of public safety, justice kind of group here. Thank you.
Well, the public defender is my favorite, so here we are. The floor is yours, Ms. Singh.
Thank you, Madam Chair. I think as the board is aware, our department is the only one that is constitutionally mandated to perform its job. And that presents us with sort of an unusual dilemma in this case, because we have, on the one hand, thousands of clients, and we have to consider their health and safety and the health and safety of our 100 employees. And on the other hand, we have the constitutional issue that the clients have a right to come to court within a certain time frame. And so when the crisis started, as a department, we made the decision that in this point in time, the health of our clients, many of them in jail, and the health of our employees had to take precedence over other values. It's very difficult for me as a public defender to say that, but it is an incredibly unusual situation. Our courts in Kern County have been unequivocally incredible. Our presiding judge is incredible, and the Chief Justice of the California Supreme Court has also converged on the same opinion that we have to deal with the health of people now, and has taken various measures to that effect. Moving forward, as far as our department goes, we have 100 employees, and in order to make sure that the courts operate, we have about 20 employees who come every day. About 6 of them are staff who are in the office, but we have about 10, 15 attorneys who are in court. And that presents for us a real challenge. the attorneys who go to court, I mean, to be perfectly blunt, there is really no concept of social distancing in court. You know, our relationship with our clients, the relationship of confidentiality, we sit next to them, we have them fill out forms, we have conversations for 10, 15, 20 minutes with them. And that is a reality, and in that sense, we're very similarly situated to the deputies that Sheriff Youngblood has. And so that is a challenge for us. A second challenge as we move forward is to think that as each day passes, there are hundreds and thousands of our clients who are sitting in jail, who are sitting in prison, and you know, we've put that issue off for right now, but at some point, you know, we have to have that conversation about how to balance those rights with the health concerns that we have. So I'm happy to take questions.
Ms. Singh, thank you. Gentlemen, any questions? Supervisor Maggard, and you. Go ahead, Supervisor Maggard, and then Couch. Supervisor Couch.
So should we be suggesting that those that are in these mandatory confined spaces, should they be wearing masks?
Supervisor Maggard, that's an excellent question. It's sort of a question we ask every day when we go and talk to the clients in court. I'm not sure what the answer is, and I was hoping Mr. Constantine could offer an answer. The reality is, you know, we're very self-conscious that we may be transmitting something
to them,
to our clients. Our clients, I know that there have not been any cases, as you've heard, but really at this point, the danger is more that, you know, the 10 of us are in the community. We go and talk to our clients, and what is it that we're sort of bringing to the situation. So I'm not sure. Frankly, I'm not entirely clear in my own mind as to how transmission occurs, other than, you know, being told that we should not touch our face, we should constantly wash our hands. I wish there was some direction as to whether gloves and masks would help in the situation. If they do, I think we should move in that direction and move in that direction quickly.
Thank you, Ms. Singh. So I don't see Mr. Constantine in the room now, but can somebody coordinate to make sure that for both the public defender and the DA's office that protocol, they know if those protocols are helpful or not?
I will recommend that Matt call you. In my discussions with Matt, the best protocols are related to masks and gloves are for that equipment to be used by the healthcare practitioners right now, the people in the hospitals, the people that are treating and interacting with potential people who are showing symptoms. The very best protocols for all of us to take is social distance, wash your hands, don't touch your face, stay home if you're sick, and don't interact with anybody who seems to be sick.
We're just having a dialogue. This is not a perfect circumstance. That's precisely what my concern is. We are requiring some of our employees to be face-to-face with the public.
That's right.
When we require them to do that, we have an obligation to make them safe. So it's going to require more than we've done. To tell them to stay apart isn't possible, unless we're going to put a shield between them. We need to give some thought to this. And somebody shared with me when this might peak in California. This may peak in California on April 27th. Hundreds and hundreds of interactions are going to take place between now and April 27th, and then it'll be weeks before the curve falls back down. I don't know when that is. I'm just picking a date because that's what I read. But we are not. This is not any criticism of you. The social distancing guideline is not sufficient. It does not deal with the circumstances we're putting our employees in. So we need something beyond that to be able to tell them.
I really appreciate that, Supervisor, sincerely, because the same concerns that are in place with healthcare professionals, which is proximity to an exposed patient potentially, or even your own exposure, are all present in the work that you do. You're changing, I mean, pens have to be exchanged, papers have to be constantly exchanged, because that's the nature of the work that you do. So I am also very concerned. I know that yesterday was told by Mr. Constantine that the CDC is not recommending masks at this moment. However, for personnel within an institution such as a confined space where we know the ventilation system is moving the air more rapidly than you would have otherwise, and you're in a confined space. So look no further than the choir case in Washington State to see that in a confined space where people are still practicing social distancing, you can still have quite a bit of transmission. So not to alarm everybody in the public, I think we have a good handle on how we're addressing this, but you're particularly vulnerable, as are your people, to Mike's point, Supervisor Magritt's point, excuse me, and I think we need to take action on that. Pam, if you could please communicate with me as soon as you hear from Matt, because the circumstances for the public are not the same as attorneys who are trying to convince their client to trust them and not speak so loudly that others can hear what you're doing. The advice that you're providing to people whose lives and liberty are on the line. So this is serious. Thank you for bringing this up and conveying your concern for the people who work for you. I think that is admirable and righteous. And please, please, let's work together on this to get answers fast, because I do think in your circumstance, given confined space and proximity, that you're as vulnerable as the healthcare professionals. And arguably worse because of the nature of the jails and its physical composition and the amount of human interactions that are happening in and out of that courtroom is maybe even worse than a medical place that's more inclined to be safe and clean. So thank you. This is important. Pam, I'll follow up with you.
Thank you.
Madam Chair, I just wanted to offer up that we have a process in place for all department heads to contact public health and request equipment as needed, and to discuss with our public health officials any concerns that they have or any equipment that they may need, and those orders are filled by public health.
Thank you so much, Ryan. Good to see you, Nick.
Madam Chair, members of the board, Nick Cullen, your department head for animal services. As you may well know, County of Kern operates 3 animal shelters, one in Lake Isabella, one in Mojave, one in Bakersfield. All 3 are closed to the public. The normal services that you would typically go to the animal shelter for, licensing, to turn in a stray pet, maybe go adopt a pet, those are not available to the public. That being said, approximately 30 of our employees still report for work. That includes approximately 15 animal control officers and another 15 to 20 animal care workers that care for the pets in the shelters. Thankfully, that's over half of our entire department. About 60% of our work staff does come to work on some basis. Thankfully, we were able to consolidate pets from the outlying shelters so that we could send those staff home permanently, and there's no need for them to report for duty at all. The Bakersfield shelter right now, actually the whole sheltering system is only caring for approximately 50 animals. So the shelter staff that shows up there caring for 50 animals, the reason why they're only caring for 50 animals is because there's approximately 130 animals that are being cared for by community members right now on a foster basis. Our animal control officers are on duty. They're normal shifts, and they respond to emergencies only 24 hours a day, 7 days a week.
I notice the reports are getting shorter and shorter the closer we get to lunch, right? Nick, thank you. That's very, very helpful. Supervisor Gleason.
Thanks for coming up, Nick. Do animals carry this stuff? Do
No.
they transmit it?
No,
I mean, to dogs and pets. So you're finding in your animal shelters, yes or
There
no?
is no known transmission from dog to human, other than fomite transmission.
Okay, thanks.
No bats, Nick.
No bats.
Supervisor Couch.
Did you have a drive-through adoption event?
So yes, it was not an adoption event. When we got the word that our facility would be closing as well, when we made that decision, we immediately started thinking, what does that mean for all the animals in the shelter? Because we had about 175 animals that would be in a kennel for the next 30 days. And we still continue to bring in animals from the field. So our only option, because we can't perform an adoption, because we can't get them spayed or neutered in time to get them ready for adoption, which is a state law, is foster. Temporary care. So we reached out into our community, and we asked our community, this community that supports us so well, will you help us care for these pets? It was a drive-through system that we set up. It was during those first 3 days, that Tuesday, Wednesday, Thursday, before the stay-at-home order. And we saw about 300 Kern County residents that submitted applications to foster pets. It was an overwhelming response from this community. We sent about 100 pets to foster in those 3 days. We stopped doing that at the stay-at-home order, but like I said, we have approximately 130 animals that are currently being cared for by the community instead of county staff.
I just want to compliment you on that for thinking quickly and acting. You made the news back east, Florida or somewhere. I got a message that you guys were on the news on the East Coast for that act. So
I would love to take the credit, but you have some fantastic human beings that work for animal services. So.
Thank you.
Oh, well, I understand you were the only one who did it. We, Kern County.
We, yes.
Thank you very much. Spirit of excellence, I like that. Thank you. Who's next?
Good morning, Supervisors. Glenn Fankhauser, Ag Commissioner. Currently, we continue with our exotic pest trapping program. That's necessary to ensure that we're free from certain pests so that growers can export their produce. We also complete produce inspections as well as issue documents, excuse me, so that they can move those products around the country as well as around the world. We are responding to complaints as they come in, and we're also still conducting our random inspections in the field on pesticide applications that are occurring.
Would the pesticides believe they're random, the screenings?
Not necessarily, no, that's true. It's random in the sense that we're always out looking for them, so.
Gotcha. Thank you so much. Any, Supervisor Gleason?
No. I'm sorry, that wasn't me.
Okay, thank you. Anyone else? Thank you so much, sir. Appreciate you.
Good morning, Madam Chair and Supervisors. Mark Witzel, your Airports Director. Our system of 6 airports is still open for operations. With less than 24 people, we continue to staff all the essential positions. And some staff are working from home to the extent that they can. We have reduced the days and hours of badging, credentialing for our security program, but the William Thomas Terminal remains open despite the 90% reduction in travelers. And I'd be happy to answer any questions that you might have.
I'm sorry, what reduction?
90%.
That is painful.
It is very stressful for both of our air carriers and the partners that we have with the rental car operation and the commercial parking lot.
Yikes. Supervisor Couch.
Do you know yet, you probably don't know now, but, or maybe you do, how will this affect the SCASD grant?
So it, still waiting for the final numbers, but it turns out the revenue guarantee that we'd entered into with the carrier timed out on March 3rd.
Oh, really?
So, and that was kind of just at the beginning of when we started to see significant reductions in air travel. They have yet to report what the numbers were or the revenue levels were, but I'm hopeful that it's not significant. More importantly is looking forward in that as they recover after this peaks, you know, what is going to be the public's acceptance of air travel going into the summer and then into the fall. So this may be a longer economic event than it is a health event.
As I recall, that was a 3-year grant?
It was a 2-year grant,
okay.
But the revenue guarantee that we signed was for 1 year.
And so, to date, have we had to access, the reason I'm asking, there were, private industry put up a lot of the money.
Correct.
In addition to ours. Has anybody have we had to access that yet?
The public's
money.
response to the 2 flights to Dallas was tremendous, and American Airlines was making fantastic money on that route up to the point of COVID-19.
Good, thank you.
Thank you.
Supervisor Scrivener.
Thank you. Mr. Whitso, how is that 90% reduction in travelers going to impact your budget?
Well, we had a fantastic first 8 months of the year, and so as we have forecasted, we should not have a shortfall in what was appropriated by your board for 1920. Looking forward, again, is somewhat difficult to understand how that is going to then translate through the summer months.
Like,
So-
with the car rental companies, how does that relationship work as far as them operating in the airport? If they're seeing this, such a big reduction in rentals, how does that affect the contractual relationship between you and them?
So it does affect it greatly. For better or worse, we're in an at-risk relationship with the rental cars. So we are collecting a monthly minimum from them and ultimately that or a percentage of gross revenue, whichever is higher. Certainly when the gross revenue drops so precipitously, then we would then be relying on the monthly minimum guarantee. At some point, with the drop in employments, another clause kicks in where that monthly minimum then goes away and we're back to percentage rent. Again, I will say that the quite promising and exuberant first 8 months of this year may carry us through the rest of this budget cycle.
Okay, thank you.
Thank you.
Supervisor Scrivener, thank you. Anyone else? Okay.
Thank you.
Thank you, Mark. How many more reports do we have, Mr. Alsop? 153, Supervisor Maggard said. Okay, so we have several. Do we want to continue?
I think if we could ask all of the departments to keep their comments brief, I think we could get through it fairly quickly here. We have just really just over a handful more.
Okay.
Good morning.
Good to see you, Mr. Poe.
Madam
Always
Chair,
good
members
to
of the
see you.
board. Public Works is one of the essential functions, and every week we try and put together a 2-week look ahead to try and figure a schedule. So far, with all the changing environment, changing rules, we're lucky if those setups last more than about 5 days, 3 to 5 days. So it's a constantly changing environment, and we are adapting as we go. Our current level of operations are as follows. Most of our waste facilities are either fully open or operating on a limited schedule up to 50% of the time that they were. Our roads and traffic crews are maintaining critical repairs and keeping roads open. Majority of them are at home until they're called out for a reason. Pothole shows up or there's an accident and something's knocked down in the road, we'll come out and take care of it. Kern Sanitation Authority, that's our sewage, is running at 100%. Building Inspection Group is operational with alternative protocols. They're doing new construction, but the remodels and things like that are kind of on hold. We're not going into people's houses unless, we can make arrangements. Transportation encroachment permits are available electronically. That's one of the things we used to do over the counter, but we now have methods to handle electronically. Kern Regional Transit is operating on a reduced schedule. We've cut out about 50% of the runs, but we are down 75% of the ridership. When the schools closed, most of the ridership went away, so we're down to about 25% ridership, but we're still got better than half the runs. That has occurred, and I've yet to hear of any complaints, so we'll keep on that. Surveyor's office and map room are closed, but the survey crews are working as necessary. Building permit applications remain operational. This is where people submit for new applications for buildings. We do that electronically, and it's flowing very well. The ones that don't have the ability to do electronically are submitting by paper still, and we set the papers aside for a couple days just in case and then get to them. So that's all seems to be working with very few complaints. construction team is working. Those are the guys that are working with the contractors out there on the projects we have. They are out, if the contractor's working, we're working, and that seems to be moving pretty good. Code compliance is closed, but the complaints we're receiving, we're dealing with. If there's any emergencies, we're trying to deal with them. We bring in people as necessary to deal with that. We have an equipment maintenance shop. They're still there full-time. We got to keep the buses running and what equipment that we have. Human resources group are working every day. They're the ones that are helping us get paid and following all these rules. Every day it seems like there's a new set of rules out there on how we deal with our employees. Finance group is operating at a very minimum. Some of them are working from home. Budget's coming up. We're still trying to get that in on time. Administrative staff is there as necessary, and we are basically at an emergency basis. I mean, the landfills are taking up the majority of our staffing. To keep them open, keep the public safe in them. They're working. Out of our 464 employees, we deemed 170 as essential, 294 are non-essential. That's about a little more than a third are deemed essential. I think with that, I'll ask if you get any questions for us.
Mr. Pope, thank you. Supervisor Maggard does.
Thank you. Great job by your department. I'm grateful for all you're doing. This is not any criticism of anybody, but I want to bring to our attention the bureaucratic way that we work is making us too cumbersome to be effective sometimes. I'm not talking about abridging anybody's rights, taking anybody's property away from them, but for example, I want to brainstorm with you for a moment here in public so that we can all departments can think about how we can make decisions differently. We have a situation on Niles Street, Niles and Crestmont in the Hillcrest Shopping Center. Hundreds of people are gathering, a flea market, food's being exchanged. I went there last night at 6:30 to see for myself. A food truck is there, opening up shop. We're not taking anybody's property away, but they need to get off that lot, and they shouldn't be meeting there. So going through the process of noticing the property owner who lives in LA, and that takes days, and then we post a sign, and then they get 30 days to respond. That stuff doesn't work. So how do we move through our normal bureaucratic process we have in the Veterans Department, in any department we have in the county? How do we go through and change those procedures that we normally follow so that we're not taking anybody's right away, but we quickly get to the answer, which is get the people out of that lot so they're not making themselves and us sick?
We have two situations where that may occur. One is where the property owner works with us. They can immediately put up no trespassing signs. We can call on law enforcement then to help us keep it vacated. If the property owner isn't cooperating with us, then it becomes a greater challenge. And then because law enforcement doesn't have any right to keep them off, it becomes a code issue, it becomes a public health issue. We're working together with public health to address those things, but Council, you got any advice for us on how to move faster?
And can I layer one more in before you respond? Under Sheriff Yock, there's implications in the Sheriff's Department. This will require someone with some authority to drive through that parking lot and say, get out of here. You cannot be here. The same thing is happening with regard to whether a homeless encampment is on the back wall of somebody's property, and that's endangering everybody that's in the drugs. You know, you and I are working on a drugstore that has this issue.
Right.
You know, how do we raise the priority of those kinds of circumstances so that those dangers don't linger?
Well, a lot of it's, like Mr. Pope was saying, a lot of it's going to rest with the properties being posted. Some of the issues we had years ago on Niles when I was out on patrol dealt with some of the larger complexes that had multiple stores. What we had to then do was we reached out to the actual property owner, and they wrote a letter giving us the authority to make people vacate the property. Once we have the legal authority to make them leave, and we tell them to leave if they don't, then we can cite and/or arrest for trespassing. But we have to get our legal authority to be able to do that first.
So, and I'm not trying to put you on the spot, I'm just trying to solve problems. So if we have an incident like this on Nile Street, can we work with each other just to have a cruise, one of our deputies cruise through the area, park in the parking lot for 5 minutes, you know, are there creative ways are there other departments we can get, maybe probation can do it for us, but are there, you know, how can we creatively make sure that when we get a hotspot like that, and it's on Nile Street today, it'll be in Roseland tomorrow, and it'll be in Ridgecrest the day after that. How do we, can we flex back and forth to make sure we're doing what we need to break up those kind of things?
We can get patrol to saturate patrol in the area and see what they can enforce. It won't be the trespassing unless we have the authority to do the trespassing by it being posted. But if we have people in there that are underage drinking or any other law violations, we can enforce those. And a lot of times just by the mere presence of law enforcement, they'll move on. I know we work with public health on some of the food truck vendors anyway and go out with them and partner up to go and be there when they shut them down. So we can also reach out to public health to see if they can go and make sure that the food vendors that are there are licensed and even should be there. Because if we move the food away from there, if they're not legally supposed to be there, the other folks are going to follow and leave as well.
I recognize that there's a sense of urgency in my voice, and I'm not meaning to be provocative with anybody. I just, I'm just trying to jump to the chase.
No, we completely understand. It's quality of life issues, and we want to address them, and we want to make sure that they get remedied and get out of there. But I'll ask patrol to step up those areas. I don't know if there's specific nights that they're there, but I'll have them drive through and see what we can enforce. Friday,
Saturday, Sunday is what they said, but I don't mean to make this about one little spot in my district. Ms. Rezon, did you need to say something about that? Thank you, gentlemen.
Thank you, Supervisor Maggard, through the chair. I was just going to add that based on the local health emergency declared by Matt Constantine yesterday and ratified by your board this morning, during the tenure of this of the local emergency, the health officer has expanded powers, and he can issue orders and can take measures as may be necessary to prevent the spread of the disease or occurrence of additional cases. And he has the ability to issue orders that would require people to not congregate.
So might that apply to a flea market in a grocery store parking lot, or a pastor in Delano or McFarland or wherever, this guy that was on the news last night that refuses to shut down his public meetings?
Correct.
Okay, so do we refer those concerns when they're expressed to us to public health?
I would at this point, yes.
Okay. They may need some resources,
They
because there
might.
might be a lot. Okay, thank you. Appreciate you guys indulging me.
Thank you very much, Supervisor Couch.
Mr. Pope, have you already thought of this? Can you guys get more work done now since there's so many people off the streets, for example, on your roads?
That's clever.
We're finding it easier for the crews to go do what they need to do, yes.
Given the emergency or whatever that we've declared, do you have any special authority to move contracts along quicker without stuff that you know you're going to do anyway, that you might be able to just do in the next month or two?
So much of our world is based on contracting law that is tied up at the federal level even, so it's
So
hard
no?
to see. What's that?
So the answer is no?
Probably not. We're pushing as hard as we can.
Well,
though.
take a look at that. Anything
Yes.
you've got based on this emergency that can get work done quickly that you know is going to get done anyway when people are not out driving around.
Will do.
Thank you.
Thank you, Supervisor. Okay, Supervisor Maggard's done, Supervisor Couch is done. Anybody else before we move, okay? Well, Mr. Pope, I think you can appreciate the length of time that you're at the podium correlates with your incredible human significance in Kern County. So thank you.
Thank you.
Director Oviatt.
Good morning, Lorelei Oviatt, Director of Planning and Natural Resources. So 25% of the Planning Department is working as essential, with 75% working from home, but through Microsoft Teams, we have managed to keep our permitting going. We are closed along with the Public Services Building. We still coordinate with the Building Department to make sure that our part is signed off to keep building permits going. As you know, we have challenges because of your board schedule, our planning commission schedule, and our director's hearings, and we are working our way through that. The planning commission was canceled for April. We are working on options, and we are working with Ms. Kraus on her ideas on how to do the planning commission safely in May. We also have public outreach issues, which you heard some comments this morning in public comments. We have over 2,500 jobs that could be happening in 2021 if we continue to move our projects forward. And we are committed to doing that. We understand the community's concerns about public input. There are laws which are not set aside by these emergencies, but we are committed that if these companies want to continue processing and are committed to having these jobs available in 2021, then we are committed to finding a way through it. We may be bringing to your board, after consultation with county council and our outside counsel, some options where your board adopts different procedures for public input. And I'm available for questions.
Supervisor Couch.
Have you been busy lately?
Yes, thank heavens, still busy.
Talk a little bit about what you have accomplished just with the oil and gas.
Oh, thank you.
situation.
Yes, this 25% essential, before May 25th, we had others who were working under the court deadline of 30 days. We had a team, a variety of teams between GIS, oil and gas technicians, as well as fiscal, all working diligently as well as weekends and overtime, although we ended up sending them home for their health, and we would keep a track of that, to permit oil and gas permits that the court allowed. We did more in 30 days than we do in 4 months. So we did not cut any corners, but this team produced 1,049 new well permits, which now the oil industry can use for investor confidence. They now have to go to the state and get their permits. I'm very, very proud, and I know that we're not on the front lines of health, but we're on the front lines of the healthy economy that we hope to have when this crisis is over. Thank you.
Thank your employees for their hard work.
Thank you.
Well, Director Oviatt, I do want the public to know that on the holiday of Martin Luther King, you were requested specifically by the governor of this state to help advise and guide this great state in the next steps of energy evolution. And I think it's an extraordinary life achievement to have been called upon now by at least 2 governors who know you by first name. I think it's utterly extraordinary, and we so appreciate you.
Thank you. It takes a team, and now it takes Microsoft team. So I just want to send a shout out to IT. We all don't know what we're doing on those ITs, and we really appreciate their help in helping us get up to speed with technology. Thank you.
Thank you, Director. Who's next?
Good morning, Madam Chair.
Good morning,
Board
Ms.
members.
Chavez.
Elizabeth Chavez from the Department of Child Support Services. We currently have 240 staff members in our department. 150 of them have been designated as essential. Of those 158 staff members, 49 are working remotely, and the rest were rotating in to keep less than 30 staff members in the office, and we're distancing them, so we have cubicles set up and the break room set up in a way that they don't interact with each other. We are working, the state just gave us permission to take our desktops home and VPN from there. So we're in the process of setting those up, and once we've met those metrics, we'll be able to send home more staff with desktops to VPN into our office. So we still have the office open between 8 and 5 for payments. We have a self-service kiosk where customers can make their payments in cash, and they're still accessing that. If they need to sign any legal documents, we're available between 8 and 2 by appointment only. And we've set up video conferencing equipment in our interview booths, so our staff are in another location. They meet with the customer via video conferencing, and if they need to sign a stipulation, then they bring that out. We've provided them the necessary items to keep themselves safe, such as gloves. And they come out and sign their legal documents, and then they can leave. But we're trying to do as many interviews as we can via the phone. They also have the opportunity to access us via Customer Connect, which is our statewide system, which sends us an inquiry, and we can communicate with them via that system. So we're trying to keep as many customers as we can out of the building. And so far, yesterday, we only had 4 customers come in, and that's showing that we're meeting our goal of distancing our staff from any protecting the public, but also protecting our staff.
And you're still open, which is great.
Yes.
When did you put the self-paid kiosk in?
Our self-paid kiosk has been in there 2 years. And so our customers do use that. We have a large population of customers that pay in cash. And last year, we collected over $1 million just through that kiosk. So it's really important for us to keep it open between the hours of 8 and 5 so they can come in and make their payments.
Outstanding. Supervisor Kelcher, you punched in for this item? Okay, Supervisor Maggard?
Thank you. Tens of thousands of children rely upon the effectiveness of your department. I appreciate the importance of it, so thank you for your leadership. If we are beginning to send, did I understand you correctly, we're sending our desktop computers home so they can work from home?
These are state-issued desktop computers, yes.
So are we, what precautions are we taking to make sure that whatever signal they're using from home to work, their Wi-Fi signal or whatever, is secure? And is the data and our system, as it interacts back with us in the state, how are we protecting ourselves from being invaded by viruses and whatnot? I don't mean this kind of virus. I mean standard old computer viruses at home.
Supervisor Maggard, through the chair. We actually have protocols that the state has given us. That's why we couldn't take home our desktops. And we have to put in certain authentications before you can even access the system. And then what we're doing is we're VPNing into the county network. So we are already in a secured network to be able to access our state application. So it goes through the same process as we do here in the office. It's just accessing it from home to the network in the county.
Thank you. I'm bringing this up because this is an issue in business, in the business world that they're facing right now. Tons of people are taking their desktop computers home. So we're going to come to a point, if this runs out into May and thereafter, where we don't have enough laptops. So can we just be anticipating how we're going to transfer our equipment to remote locations and how we keep it safe? I'm looking past Ryan at our IT guy over there. Thank you.
And I will say that IT has been very helpful because they immediately, on the first day, provided us VPN accounts for the laptops that we did have so we could send home 49 staff members with laptops. So we have a pretty good relationship and partnership with them right now to be able to continue to do that with our desktops once we have tested and verified that they are set up correctly.
Okay, thanks very much.
Supervisor Maggard, thank you. Anything else? Okay. Thank you, Ms. Chavez.
Good afternoon, Madam Chair and members of the board. Just want to kind of reiterate the Aging Adult Services right now, there's about 90% of our staff are working from home. We are fortunate that we're able to work off of iPads. This includes your Adult Protective Services staff, your in-home supportive staff. This also includes our conservatorship program. Adult Protective Services is still doing face-to-face interviews or investigations as it relates to individuals being abused, obviously, physical, sexual abuse. But they're also dealing with a lot of emergency cases, things related to food items and things like that. In-home supportive services, we're returning calls and working on cases just like we would be normally in the office. Our information and referral call line has been inundated, as you can imagine, with the number of calls of seniors trying to get information, as well as in-home supportive services question and answers. Our senior nutrition program is still operational. Our congregate sites or senior centers have been closed. We closed the senior centers relatively early in this process in light of the fact that obviously those 65 and older are more vulnerable to this situation. We do offer Meals on Wheels. That has not changed. We're still delivering meals on a daily basis. We're also offering meals for pickup at senior centers if they so choose. Right now, we're trying to migrate to a situation where we're trying to get them all on Meals on Wheels. We just are trying to build our capacity to do that. That includes obviously finding drivers that'd be willing to make those deliveries happen. But that is a challenge for us altogether. We're also looking at purchasing shelf-stable meals in hopes that we can provide additional meals to seniors that are homebound and can't leave their home. One of the things that we're currently doing is we're coordinating with CityServe of Bakersfield. They are accepting donations for our seniors Monday, Wednesdays, and Fridays from 9 to 12. Donations such as non-perishable items, paper goods, water, those items that seniors are in need of at this point in time. Along with the partnership, Bakersfield Realtors, Christmas for Seniors, these are items that if people are willing to donate, you can donate them at CityServe and their locations at 1431 L Street. And again, they'll drop off donations on Monday, Wednesdays, and Fridays from 9 to 12. Do you have any questions? That concludes pretty much my presentation.
Supervisor Maggard, are you punched in for this? Thank you. Supervisor Scrivener.
Thank you, Lito. I recently received an email from a constituent up in the Fraser Park area, and their concern was with the supply line to their one market that they have up there, specifically for folks that are seniors. And so I appreciate all the services that you already provide to our vulnerable senior population as far as Meals on Wheels, et cetera. My staff has tried to get a hold of this constituent to find out exactly what it is that they're, specifically what they're concerned about, and maybe if they know people that they think are particularly vulnerable. Haven't been able to do that yet. We did contact the market up there, ask them, what are your issues? And it sounds like it's probably the same as just about any market: cleaning supplies, toilet paper, et cetera. And so what can your department do to help us to identify people who right now, because of those supply chain issues, the senior population, disabled population, what can we do to help identify those people and get them services that maybe they didn't feel that they needed or wanted to utilize before, but now because of the current situation, they're in a different predicament?
Yeah, thank you for that question, Supervisor Scrivener. We're dealing with these kind of cases on a regular basis. If they call our general line, 86661-868-1000, we'll be able to match them up with the services that are out there in the community, including things that we may be able to do, making deliveries and those kind of things related to donations that we're getting from various areas.
Thank you so much.
Thank you, Supervisor Scrivener. Lito, I'll continue to work with your office and my staff to, provide volunteers and resources to seniors. I'm happy to be working so closely with you and really appreciate your devotion to,
Thank you.
Such a precious population.
Madam Chair, I too appreciate your support, and you and I have been contacting with regards to getting volunteers. I direct anybody that does have volunteers that are willing to serve to go work with CityServe. They have an online site that you can fill out a form to volunteer for them. They have a whole assortment of duties that if somebody's willing and able, please contact them.
And did the MAOF people get matched?
They did. Yeah.
And that's working?
And that person is working for us in our nutrition program at this point.
Outstanding. Yeah. Do you need more?
Yes.
Okay.
Drivers,
Thanks, Lito.
particularly drivers.
Drivers. Those people were not drivers, Lito?
They weren't drivers.
Got it. Thank you very much.
Okay, thank you.
Actually, it's good afternoon. Bill
Good
Walker, Madam
afternoon.
Chair, members of the board. Before I start, Supervisor Gleason to the chair, the World Health Organization has ruled that dogs do not carry the COVID-19, and so you're able to say, "Who let the dogs out?" For my report
Brilliant.
for you today, sorry, it's pretty dry. I thought someone needed to do it. We are a staff of approximately 1,000 staff, and we manage over $100 million in hospital and outpatient contracts, most of them in your outlying districts. And we're managing a caseload of over 12,000 active clients. We went operational with our DOC on March 16th. We deemed most of our staff as essential. All of our non-direct systems, which are IT, finance, and many of the plan responsibilities, were moved to homes. We have ordered hundreds of laptops and smartphones. We've deployed them. We're ordering more. And of course, downtown IT has been very helpful in the VPNs and the other accounts. All of our direct service systems I'm going to go over now. The mental health outpatient, mental health children's systems, they've all been reduced in Greater Bakersfield to the number of locations, but they are all still operational. So all outpatient systems, medical systems, shots, all of these are still maintained. We also are maintaining all of our access systems. All of the outlying area clinics that are primarily done through our contractors, we are working with them under our DOC, and they are all operational for each of the outlying areas. Under our crisis systems, we continue to deploy the mobile evaluation teams. The crisis stabilization unit, which I would point out is a Met is a first responder team. They respond directly with law enforcement. And the CSUs are a medical unit. They have a 1-to-4 nursing ratio. We also have maintained a crisis walk-in clinic, and we have contracts with 4 psychiatric hospitals in Bakersfield to run 5 psychiatric units. All of them are still operational. We've provided iPads to area hospital EDs so that they can work directly with our Met units and other units to get an evaluation in the EDs as we expect the EDs to become more saturated. Our hotline has continued to be operational and now is marketed as a warm line for COVID-19 in concert with the Public Health Department. We also work directly with the EOC and are working on the plans for the homelessness, the 15 trailers, and what our role will be in any build-up if they do a surge capacity at the fairgrounds. Under the Substance Abuse Department, our outpatient systems also are still maintained, but also our narcotics treatment programs, methadone maintenance, the other dosing programs, all those medical programs are still operational, as are our residential and SLEs. We maintain a very active website, PIO messaging internally and externally. I'm doing a town hall for all of our staff from home or from work at 3 o'clock today to listen to them and their concerns. In terms of our asks, I think what I'm beginning to get now is pushback because I have so many staff that are on the front line and you can't easily socially distance when you're doing an evaluation of a patient or if you're giving a shot. And the current guideline we are following, and it's the right guideline, but it's if someone's not symptomatic, you're not gearing up. You're doing social distancing, washing your hands, all of those things. But if you are providing, like in our crisis stabilization unit, over 800 people come through there every month, brought in right off the street, and it is a locked unit. You can't expand it without the right doors, and you can't expand other buildings because of safety code violations. So they're in an at-risk population, and currently, if someone comes in and isn't symptomatic, they provide the care. And right now, what we're all seeing is there's a lot of people that are asymptomatic, but are actually positive. And so I would really ask the county to look at when do we advance, and this is a public health question really, when do we advance what level of PPE we use in high-risk places like that? Because even if you go to the emergency room right now, an emergency room is not going to gear completely up if someone doesn't have COVID symptoms. And I think that's kind of a bomb waiting to go off personally. So I would just ask us to look at that. Also, I just want to bring to the point that the PPE is probably going to be one of our difficult things. I know the Public Health Department has given us a 30-day supply. We are also, like others, ordering our own, but are getting orders canceled. And so the handwriting on the wall is it's a kind of an all hands on deck, but Public Health Department has been fantastic in their response to our department. And I am available if you have any questions.
Bill, appreciate your candor. Anyone on the board? Got it. Bill, thanks. We'll be in touch. Is this our last presentation? Do I see any other department heads? Oh, we have another one. Oh, we've got several. Okay. I don't mean to rush you, really.
I'll be quick.
Our Veterans
Madam
Department.
Chair, member of the board.
Near and dear.
Currently, we have 25% of our staff that are deemed essential. We have successfully transitioned to telephonic and email appointments for most of our clients. We can do claims via a phone app where our clients don't need to be with us to sign forms.
I would think some people would like the telephonic and not in person.
A lot of people are enjoying it, so a bright spot for us is we're finding new and innovative ways to help our clients in remote areas.
Veterans in particular, you know.
Yeah,
That's
so
cool.
That's kind of how we're successfully kind of helping our clients as well. And I've opened any questions if you have.
Wow, that's a record. Absolutely, absolutely outstanding. Thank you for what you do. You know, we're here for you. You know that. Good morning. Good afternoon.
I'll try to be brief as well. Teresa Hitchcock, Assistant County Administrative Officer over Economic and Workforce Development. As you may realize, a lot of our business community has been particularly hard hit by that fallout from this virus. So we've partnered with the City of Bakersfield, the Bakersfield Chamber, and Kern Economic Development Corporation to set up a couple of avenues for business resources, especially the new business resources that have been allocated by the federal government. I do have some information, if you'd like to get that out to any of your constituents, about how businesses can access the resources that have been set up for them. There's a business resource guide. We have a hotline for businesses to call that's staffed by my staff from.
Is there an individual, Teresa, a specific person that they can go to?
If they call the business hotline, it is actually answered by a live person. They are bilingual in English and Spanish. We have identified other staff members who speak other languages if someone needs it. So we have people who speak Cantonese, Mandarin, Korean, and Tagalog. We are currently looking for someone who speaks Thai so that we could so we're trying to find other resources for translation services because we do realize that we have a very diverse business community here in Kern County that we're trying to provide support services for. So there's a business hotline. The number is 336-6860. Any businesses affected by the COVID-19 outbreak are welcome to call that. We will get them in touch with the resources for business loans. As Supervisor Maggard mentioned earlier, the federal government has set up a loan process for small businesses in particular in order to help them through this crisis. And then there are a number of other resources that we have available for them as well, and it's all available. And I also wanted to mention that my staff are not in the office at this time. They are all working remotely. We have equipped them with laptops and cell phones so that they can continue to provide case management and also help folks who are displaced find out how to get UI benefits and some of the other things that a lot of displaced workers will be looking for right now. I also wanted to mention that as this began, we placed 56 nurses in our local healthcare system through our agency. Right now we have 262 people in training. More than half of those are training for medical occupations, including 77 RNs and 34 LVNs. So we're hoping to get those through their classroom training. Our training providers have moved their classroom training to online. We are equipping folks who do not have the ability to do that from their homes with laptops as well so that they can be successful in their online training. And I am available for any questions.
Wow, that's exciting. Great work, Teresa. Making some lemonade there out of some lemons. Supervisor Mick Gleason.
Thank you, ma'am. How are we reaching out for Eastern Kern? Specifically with that first thing you were talking about, that business development. Are we reaching out to the chambers? Are they responding?
We are. So Richard Chapman was a part of this partnership, and so my part of the partnership was to set up the actual hotline and to staff it, so we have done that. Richard is getting the word out. His part of this partnership is the marketing side of it, so he has sent this out to all of the city managers, all of the local chambers. He's gotten it out to our East Kern Economic Development folks as well, and so we are trying to get the information out as widespread as possible.
Thanks.
Thank you, Supervisor Gleason. And thank you, Teresa. Hi, Andy.
Hi.
Good afternoon.
Good afternoon. We're closed. That might be the shortest it's 10 seconds.
But somebody said earlier they could get Wi-Fi at the library.
They can, but we're also doing a lot of online virtual programming. Our staff are very creative. Believe me, they find ways to connect with our residents, and our residents find ways to connect with us. Do have some concern when we do reopen and all of the transactions that we have constantly at our 24 branches in terms of masks and gloves. So I'll talk to Matt about that later. But other than that, that's what's going on. We're working from home. We really are. We're all working from home. So
I believe you.
I know. I was trying to keep it short.
Thank you.
May I ask you one question?
Supervisor Maggard, my apologies.
Andy, are the Wi-Fi signals left on in every branch?
24/7.
Very good.
Yep, at all
Thank you.
branches. And I double checked with the city of Shafter at the Shafter branch, and they have upped the signal there as well.
Wait, Andy, Supervisor Scribner.
Just real quick, I wanted to say that my two daughters, 8 and 6 years old, and we did the story time online, and so as one of your employees from the Tehachapi branch was doing it from her home.
Yep.
And so it's really great. There's a lot of resources, the things that you're still trying to provide.
Absolutely.
And so we really appreciate that.
Yes, thank you.
How
They
nice.
are, and they're doing that at most of our branches. They're doing online activities for families. We know that they're home, so.
Thank you, Zach.
You're welcome. Yes, sir?
That's a really good point. And what are we doing to make sure that everybody in Kern County understands that that's available? Are we broadcasting that out?
Absolutely, the CAO's
So the
office,
message
too.
isn't the libraries are closed. The message is what?
We're online,
Okay, and are we getting that word out there?
absolutely.
Okay, thanks.
Yes.
Great question, Supervisor Gleason. Thank you. And thank you, Andy. Okay, who's next in the hot seat?
Good afternoon, Dr. Brian Marsh, University of California Cooperative Extension for the Farm and Home Advisors Department. The UC advisors are all working full-time, but remotely, mostly at home. We're still meeting with clients through phone calls, emails, video conferencing, whatever we need to do that way. The county employees that support us are essential because we couldn't work without them, so they are still going to the office, reduced hours, limiting, overlapping, but they have the run of the office because no one else is there, so they are doing the social distancing that they need to do. We are getting a lot of increased requests now that people are spending more time at home. They have more interest in what their yard looks like and more interest in home gardening and food preservation. It'd be really nice if we had master gardener and master food preserver programs up and running, but that's something down the road that we can work on.
In the last month, we've planted tulips, squash, chilies, new chilies. We've revamped the garden. It really has been a good opportunity in that way. So thank you for being there as advisors, because there's a lot to it.
And we
Green
have lots
thumb.
of information that is already online, and we're generating some more interactive materials to be online
How
for
very
people to
cool.
access.
Thank you for that. And Supervisor Maggard.
Thank you. Brian, I was contacted by a local nursery, White Forest Nursery. I grew up with Jerry, the son who runs that company. And they have some great ideas about helping learning opportunities for parents who are now trying to walk their kids through lessons at home on how to learn things, about gardening and hummingbird and feeders and all kinds of different ideas about how to use this opportunity to kind of help your kids discover the backyard and all that. So is your office of some assistance in that as we direct people to go do those kind of things?
Yes, we can certainly help in that way. We can also refer them to all of the online information with all of the University of California resources, including hummingbirds, bees, gardens, vegetables, all of that.
Very good. So I know the gardening nurseries is a better way to say it, are available to do that, but can you give us the phone number of your office so people know where to call to find that out?
The main office number is 661-868-6200. And to go online, the easiest way is to Google University of California Cooperative Extension. And our main site will come up, also the local sites, and there's just so much information online.
Very good. Thank you.
You bet.
Madam Chair, Supervisors, John Lifquist, Assessor Recorder. The assessor is closed to the public, but with the exception of a few people coming into the office, the rest of the staff is working remotely thanks to a lot of work from IT. We didn't immediately have our front counter phones answered. We now have messages on those, and therefore any questions can be answered within minutes or hours at the latest. On the recorder side, the recorder is closed to walk-in traffic. We are still accepting deeds through the mail electronically, and we're converting an old bank deposit box in the front with the help of General Services. We just need a key for that so we can have a drop-off. Vital records can be ordered through the mail or via the internet.
Supervisor Maggard, are you up again? No. Thank you very much, John.
Thank you.
Good afternoon, Madam Chair, members of the board. Jordan Kaufman, Kern County Treasurer and Tax Collector.
Jordan, I'm going to move your other item,
Yeah.
our other item, to the
Yes.
2 PM session, just FYI.
3 p.m. to the 2 p.m. session.
Our
Okay.
regular
Yeah.
afternoon session.
Okay.
So we'll come back for that one. It's a lengthy one, and we need
Yep.
to be refreshed.
Not a problem.
So, thank you, Jordan.
Not a problem. Real quick, just operationally, about 25% of my staff is essential, working either coming into the office or working from home. All banking, deposit, and reconciliation activities occurring on a daily basis to make sure that the county, all school districts, and all special districts are not immediately financially impacted. All investment activities occurring on a daily basis. Investments are being kept shorter than normal, and we're keeping more money in the bank to make sure, again, that there's sufficient liquidity for all of the local government agencies to continue their operations. Property taxes continue to be processed at our high-speed lockbox processing center in Los Angeles. There may be some delays, but it is still being processed. Obviously, the office is closed, so we cannot take cash payments or in-person payments. Deferred compensation deductions and transactions are processing uninterrupted. We don't have any phone coverage, which definitely is a problem this time of year. However, probably 90 to 95% of the questions from taxpayers can be answered from the information on our website. And of course, people can pay their taxes on our website. And I will refrain from talking about the property tax deadline because we will be talking about that this afternoon.
I appreciate that. It was mainly why I told you, Jordan. Thank you so very much. I don't see anybody punched in, but we will have many questions for you at
Yes.
2. So, and I know you'll be ready, as always.
Thank you.
Thank you, Jordan.
Madam Chairwoman?
Yes.
Just real quickly, so just to sort of finish out the public-facing, really, departments for the most part, I'm going to ask Jeff Hill to come up and just talk briefly about our parks. And then I'm going to ask, your clerk of the board to update you on sort of her staffing issues.
Okay, fabulous. I'd like to wrap up by 1. Do you think we can do that, Ryan?
Yes, ma'am.
Thank you. Mr. Hill, you get the point, the hint.
I do. This will be very brief. Madam Chairman, members of the board, our parks remain open with the exception of overnight camping. All of our restrooms are closed with 3 exceptions: Hart Park, Lake Ming, and Buena Vista. All of our reservations have been canceled originally through April 15th, April 14th, and we'll work on continuing those cancellations as we go. Our parks remain being maintained because the grass continues to grow, except we're maintaining them at a significantly less detailed way, just to maintain our folks with social distancing as well as interacting with the public, minimizing that. Our rangers are full force as law enforcement. That kind of wraps up the parks. I expect that's about it. Good. As far as requests, we have everything we need. We have stores in place of about 30 days for PPE for our staff, as well as cleaning supplies for all the areas that we service. That's the end of my comments.
Thank you, Jeff Hill. Appreciate you very much. Kathy?
I can use this mic so I can see all of you. The clerk of the board staff are all deemed essential. They are all working from home. ITS helped set us up so they all have VPN access. So they don't bring a work computer home. They're actually using their home computer or laptop to VPN into their work computer, which has all of the programs that we need to do our job. We are rotating employees who need to occasionally come into the office and process documents and complete other tasks as required, that they would be physically required to be in the office. We are taking phone calls for the clerk of the board and for the main board of supervisors numbers. So Your staff are taking all the calls that come into your district office number. In addition to that number, there is a main Board of Supervisors number that has always been answered by the clerk of the board. We are continuing to monitor. We have messages. The public can leave a message on that phone, and clerk of the board staff are answering those calls immediately. If they need to be forwarded to your staff, we give them to the chief of staff, and they take care of it. Or we are working with county departments to answer their questions right on the spot. As far as Assessment Appeals Board status goes, the Assessment Appeals Board is not meeting until further notice. And then, of course, we're working with every county department to make sure that the next board meeting has all of the items needed for your consideration. End of my report.
Outstanding as usual. Supervisor Couch.
Do the assessment appeals get a grace period? Do they get an extension of time with this?
Am I on? Yes. Statutorily, we have to make sure that every appeal is heard within a 2-year period. We keep track of that very carefully. If we had any appeals that were coming up to that deadline, we would be working with the appellant to have a waiver that would be signed by both the chair of the Assessment Appeals Board and the applicant, but we currently don't have any that are close to that period.
But the governor's order didn't address assessment appeals?
Not to my knowledge.
That's my question.
I would have to turn to Margot for that.
That's okay. You can get back to us on that.
Okay.
Thank you.
Supervisor Gleason.
So I'm getting from this morning's that the unsung hero of Kern County is our IT department. Matt, good job.
We're going to. Supervisor Gleason appropriately stated, and I hope to hear from IT momentarily. Supervisor Scrivener.
Thank you, Madam Chair. I had a couple of items for the, I think I'm going to ask the CAO's office to try to address these if we can, but just a couple of things that we've been fielding with frequency in my office are folks that are wondering if their business, their private sector business, is quote unquote essential service, if they can still stay open. I've taken a few of those personally, and then my staff is getting them. And so the county website has a list of all the essential government services, and that's great. But I'd like to see if there's a way in which we could have a link to the state's website, or I think the feds have a similar website where it lists the essential private sector businesses. So when people are going on there and they're looking at essential services, they may be able to just click on that link and then see what the essential, putting that out there as an idea to try and help answer some folks' questions. And secondly, we had a scheduled power outage for that was going to be scheduled by SCE for I think 15 hours out in Boron for some maintenance. And obviously with the stay-at-home order, people were very concerned. A lot of people have stocked up on food. And so we worked successfully with them to delay that scheduled maintenance. But I'd like to ask the board if we would be interested in contacting SCE and PG&E proactively, perhaps to talk to them about postponing any scheduled power outages until the shelter-at-home order is finished. People, obviously, they have a lot of food that they're concerned about, et cetera. I don't know what happens once we get into those the PSPS situation, if those are going to be occurring with people sheltering at home, but I would certainly hope not. And so I'd like to know what the other board members think about that, reaching out to those power utilities. Thank you.
Thank you. Are you done, Supervisor Scrivener? Thank you. Supervisor Maggard.
Thank you. I support Supervisor Scrivener's concern and request, and would ask that others voice their opinion so we can make that request. I want to say thank you to our employees, not only the department heads that are here, but through you to all the people that work throughout the county. It's I'm so grateful for the dedication of people to continue to move forward and strive and try so hard and deal with so many uncertainties. So just know that we are grateful to all of them for their efforts in that regard. And the public is grateful for, and they might not say it, but they are taking for granted, many of them, the backstop of safety that we are to so many areas of their lives. So please, I want all of our employees to know how much I'm grateful for that, and the public's grateful for it. Mr. Alsop, could you address the issue of our low barrier shelter, where we are with it, and if we are, although we may be nearing the completion of the construction, if we are not opening, give us a bit of feedback as to, the prudence of delaying a little bit.
Well, despite the tremendous headwind that is COVID-19 on many levels, and despite some minor weather and some other regular construction stuff, we remain on schedule to get it done. Construction is being finalized and completed, and I do have a date in mind, although I would, I'm a little apprehensive about putting anything out given the situation that we're in, and how I'm not sure where we're going to be in 3 days from now or 4 days from now. We're completing construction. Our equipment is standing by. Our management staff is standing by, ready to descend and get the place set up and ready for business as soon as construction's done. So we've maintained that project as an essential project, essential service. If you go out there today, people are out finishing up, and our focus is getting it open as soon as possible. But again, I'm going to be coordinating with public health and getting their advice on when and how we open.
Well, the homeless are stacking up like cordwood, and we see it throughout our community. So there is the interest of the public in having it open is not waning. So the timeline is of some significance, I think. Cap K, who is the operator of our facility, is preparing, in my meeting with them just a few days ago for our board meeting for Cap K, last Wednesday I think it was, they're moving full speed ahead to hire and have on board the staff. Well, I don't want to burn through their money or our money by having staff hired that is, we can't put them to work. So coordinating how that is going to occur is important, so we're not squandering any resources there. Secondly, I'm interested in what best practices are there? Are there any lessons we can learn from other shelters that are open as to how we manage the disease, the COVID virus, as we open up the shelter? And I'm interested in your giving us some feedback. If you don't have it now, that's fine. But I think we need to have feedback on how other shelters are being operated and what can we do to make sure we can indeed open and manage the crisis at the same time. You have any thoughts on that?
None other than to say that we will do that, and the people that are involved are the people that are really managing this incident for us, whether it's public health or Kern Medical, behavioral health, recovery services. There are many other departments that are going to be involved, but we will make sure we're using best management practices as it relates to this crisis.
Thank you. And Mr. Walker, I think Mr. Walker's still here. I forgot to ask during your time about anxiety and those in our community who have an increased level of fear and anxiety, and I guess he's not in the room. So could he get back to us with some kind of a communication via email as to what steps we're taking to make sure that the public, that's being dealt with for the public, and whether or not we should put through any public outreach effort into making sure that people know where to call when they're anxious or being stressed over this? Thank you.
Thank you very much, Supervisor Maggard. Anyone else? If we have, I'd like to hear from IT, if possible. Ryan, I know we only have about 5-6 minutes, so we want to close out, do closed session, and come back at 2. Do we have any other presentations?
Yes, we do.
How many?
3.
Okay, let's move.
So nobody's working harder than county council during this time, or our IT people, or our human resources people. If you can imagine the task of dealing with a very large workforce during this time, it's being done by HR. If you can imagine facilitating technology connections and getting everybody to work from home, our IT people are working at the fairgrounds to provide adequate communications networks there so that when we move in there, and if we do, for the alternative care site, that it's functioning and first responders have the ability to communicate. And our county council is right there every step of the way along this journey. So I want to have their internal facing but critically important, and I know Ms. Raison has her own department here. She wanted to make a couple comments.
Ryan, should we move everything to 2 o'clock?
This will just take 6 minutes,
Okay.
if you don't mind.
I prefer 5, but okay. Margot?
Thank you. I just wanted to briefly report that the staff of both the County Council and the risk management side of my office is working remotely. County Council side has all of our attorneys able to work remotely along with the paralegal and the support staff. We're responding to all timelines that are still in existence with various court matters. Most civil matters, including jury trials, have been extended, but we continue to make appearances in the juvenile court for dependency matters. We also have public guardianship and behavioral health issues that require court appearances. We are assisting every county department that is up to their eyeballs in their own COVID-19 related issues. We have a steady stream of documents, contracts, leases, and various opinions that we have been getting out of our office at breakneck speed. And on the workers' comp side, all of the adjusters, the workers' comp adjusters, are working remotely, as well as the support staff. The benefits that injured or ill employees are entitled to continue to be paid, as well as all their treatment, and the restrictions, the information that we receive from medical providers is being acted upon. We also have telemedicine authorized for workers' comp cases, as well as virtual physical therapy. So ill and injured county employees continue to receive terrific assistance through the workers' comp department. And that's all I have.
Margot. It's like speed dating right now.
Let's do this. Good afternoon, Madam Chair, members of the board. Inflection point. We're living through unprecedented circumstance right now, and I think we're going to look back and realize how telecommuting really changed our business. Let's talk about telecommuting real quick. We're leveraging our next generation unified communications platform. Director Oviatt referred to as Microsoft Teams. This is our audio and video collaboration platform. In the past 2 weeks, we fielded roughly 60,000 chats across Kern County and roughly 7,000 calls, conferences that were done and facilitated by this platform. This was made possible, if you'll recall, because of your investment in unifying all of our disparate Microsoft agreements about 1.5 years ago under this central umbrella. So that gave everyone across the county the opportunity to have the same tools across all the different businesses. The load for remote work, as you've heard, has been at an all-time high. In the past 2 weeks, ITS has provisioned over 917 new accounts for remote access. That's in addition to what we have now in total, roughly 5,000 accounts that we've provisioned for Kern County employees to access remote work. We've re-engineered some of our core functions in AuditorNet, for example, so that the Auditor Controller's Office and HR, they can fully work from home and access their critical and core systems. And as DA Zimmer indicated, we're working with the Assistant DA, Joseph Kinzel, in his office on working with them on developing a video conferencing solution. We're also exploring options with the Department of Health and providing connectivity for their alternative care center. And lastly, we're also working with the superintendent of schools and trying to see where we may be able to leverage our county parks and or county facilities in helping the community have access to our Wi-Fi access systems as well.
Wow.
That's it.
Extraordinary.
2 weeks.
We are really lucky to have you. I mean that.
Thank you very much.
Thank you.
Any
Any
questions?
questions? Thank you.
Thank you.
Keep up the good work. And don't leave us, please. Most importantly. Good afternoon.
Good afternoon. Very quickly, Devin Brown, Chief Human Resources Officer. All of our staff is working remotely or has been deemed non-essential. Our benefits staff continues to process benefits issues for our employees and their families. Of course, healthcare is an important time during this crisis, and we're making sure we're keeping in contact with those members and providing them the care that they're used to from our staff, albeit remotely. And we also are continuing to pay our employees. You may notice you got a paycheck on this last week, and so it's important that we continue to do that.
Please keep that part coming.
So we have payroll staff that is working diligently to process payroll transactions in our department. We've also stood up a team of about 45 HR contacts throughout the county departments to make sure that we're approaching our employees with the same message about their status, what they can expect from their departments as far as health and safety protection, leave entitlements. We have been very busy with a daily call every day at 2:30 to make sure that we're communicating to all of our departments with the same messages, answering all their questions from their employees up through their points of contact, and then back down the funnel to their employees with the same message. We have been busy implementing and preparing to implement the new Families First Coronavirus Response Act, which grants an 80-hour sick leave entitlement to all employees, and then an additional 10 weeks of expanded FMLA coverage. So this is a totally new body of law that we're whipped up and responding to within the last 2 weeks, on top of all the other things that we're doing. We've mainly suspended our recruitment activity at this point, but as we move into more of a consistent, stable phase with our employees on their status throughout this, we'll be transitioning and pivoting to help recruit healthcare professionals internally and both with Kern Medical as well. So we're going to be assisting them in this time as much as we can.
Really appreciate the added benefits to our employees. You know better than anybody that we have had challenges with, great pay raises. We all certainly wish that we could make major advancements there, but in the absence of the ability to do that, these kind of things are so meaningful, and our ability to bounce back, is going to be contingent on the condition of our human capital, which is how we do what we do. So I appreciate a keen attention on them. They're the lifeblood of what this county does.
Yeah, the last thing I say is this is a human issue, and so it's important that we take care of our people.
Hear, hear. Thank you.
Thank you.
Appreciate you. Okay, who's next? Are we done, Ryan, for this morning or the morning session? Okay. Great. Ryan, really, hats off to a remarkable presentation and to our people. Godspeed to you, and we love you. This is a motion to consider a closed session item number 62, make finding that the need to take action on a non-agenda matter occurred after the agenda was posted on March 26, 2020. County officials learned of significant information, and such information warrants immediate consideration by the board. County Council, as to item 62, your thoughts?
I would ask that the board vote to hear this matter in closed session.
So moved.
Thank you very much. We have a motion.
Second.
Thank you. We have a second. Please cast your votes on item 62.
Thank you. The motion is approved. All ayes.
Okay, Supervisor Couch, thanks for your motion to adjourn till 2 p.m.